International Webinar Series. Our 353rd webinar is today. That is also a great record because till date, as per up to the best of my information, nobody has, no organization even had conducted so fastest and longest webinar series. This is only due to your cooperation, blessings, well wishes. This journey was absolutely not possible without your mentorship. So I am thankful to all. Vishnu Prasad Sharma ji, V.K. Agnihotri ji, Madan Thangvelu ji, welcome, welcome. So for welcome address, I would like to request Dr. Vishnu Prasad Sharma ji, former Principal Government Ayurvedic College, Guwahati, and President Vishwa Ayurveda Parishad, Assam. Welcome, sir. And now stage is yours. After Vishnu Prasad Sharma ji, the moderation, as usual, unique moderation will be conducted by Dr. Madan Thangvelu, sir, genome biologist in Cambridge University, UK. So welcome, Vishnu Prasad Sharma ji, welcome.
Thank you. Good evening to everybody. Namaskar. Respected Dr. Madan Thangvelu ji, respected Professor V.K. Agnihotri ji, Dr. Pawan Kumar Sharma ji, eminent speaker, distinguished guests, ladies and gentlemen. Today we have World Homeopathy Day. Yes, today's webinar is on homeopathy for daily health care. Homeopathy system is a very good system, especially the pediatrical children like this medicine very much. And it is effective also, not only children, from pediatrics to geriatrics, it shows very good effective in some diseases, So in this today's webinar, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, on webinar on homeopathy for daily healthcare. And I declare that webinar is open. And once again, I welcome all of you. Thank you. Thank you. Namaskar.
नमस्कार शर्मा जी, नमस्कार।
नमस्कार
सर, नमस्कार। नमस्कार।
आज अपने फंक्शन में बिजी है यहाँ पर लखनऊ में, और अभी खत्म हो रहा है, इधर आए हुए थे। आज हमारा स्कूल एलुमनाई मीट है यहाँ पर।
ऑल द बेस्ट।
बहुत बढ़िया, बहुत बढ़िया।
हाँ, मैं अभी दिखा रहा हूँ, निकल ही रहा हूँ अभी, जस्ट इस पर को आऊँ तो मैंने अपने को ज्वाइन कर लिया है मीटिंग में। अब रहते हैं करेंगे। थैंक यू सर।
थैंक यू सर।
ठीक है, नमस्कार डॉक्टर।
I would like to welcome Professor Madan Thangvelu sir from UK, Dr. Harish Verma sir from Canada, welcome, and all expert speakers for homeopathy. Excellent sir, I am really grateful to you all. Within short notice, without knowing me, with reference of Dr.A.K. Dwivedi, you have blessed us. We are very much fortunate. Ayush Samriddhi and Independent Research Ethics Society platform is very much blessed and enriched with your dynamic, knowledgeable, experienced presence on this platform today. Happy World Homeopathy Day, sir. होम्योपैथी दिवस की सभी को बहुत बहुत शुभकामनाएं, बहुत बहुत शुभकामनाएं. I would like to request Dr. Madan Thangvelu, Hariom, to bless with moderation, his unique moderation.
पवन जी नमस्कार, अग्निहोत्री जी, विष्णु प्रसाद जी, हरीश वर्मा जी,
नमस्कार.
Namaskar. Thank you so much for we have such a wonderful gathering here. My estimate, Pavanji can correct me, we have speakers from 5 states of India in today's panel. So this is an expression of the unity and integration across India. We have Delhi, Uttar Pradesh, West Bengal, Bihar, Haryana, and Gujarat represented today. We have speakers. Myself, I'm based here in UK, and we have 2 other colleagues joining from UK today. One from Leicester and and we have Harish Vermaji, our senior colleague, joining us from Toronto in Canada. So number one, I welcome all of you to this platform. Particularly want to thank Pavanji, who drives us. He challenges us every day by making us think in ways and in different ways every day. And the topic he has given us is a very challenging one. In Ayurveda, there is a concept of looking after your health and doing something every day to look after your health. We say dinacharya. And there are many things you can do every day. And I think Pavanji, in his mind, he has a similar question to the homeopaths, saying, what does homeopathy say about doing something every day? Am I correct, Pavanji? Shayad aapki...
Yes, sir. In Ayurveda, labho payo hi shastanam rasadinam rasayanam. Rejuvenator is the one category, or tonics can be taken daily if person is having weakness or some disability. That is not prescribable, but can take daily.
And I'm hoping that our colleagues today will give us, based on that thinking, something that you can do every day, that homeopathy recommends that you can do every day. Now, one of the central aspects of homeopathy is the vital force. And the vital force has something similar in Ayurveda, in Chinese medicine. In Ayurveda, in yoga, we call it prana. And then there are many recommendations from prana that has a lot of similarities with the vital force. And when Hanuman was providing all this thinking, he was already influenced by perhaps other systems of medicine, European systems, which was influenced by Chinese, Greek systems. And all of this, there is a common thread running through all this. So that's number one. Number two is the question of water, memory of water. Water is central to our Ayurvedic system. We've had webinars here on water and different types of water as described in the Ayurvedic text. And homeopathy refines that thinking, refines the thinking in theoretical aspects that we are still unable to explain completely. And this has caused a lot of confusion in the scientific community, where people are not able to explain correctly in a language that is consistent with what is known in contemporary physics, physical chemistry, etc., about water. Although there are resources, I will put Professor Martin Chaplin's Water, the resource that runs from London South Bank University. I'll put the link for all of you to share. And when we look around the world, India, although homeopathy is a very new entry into India as Indian systems of the Ayush systems, very, very recent compared to the older systems. But clearly, homeopathy has a huge following across India. And how it is used, how people benefit, it is quite amazing. I think India becomes the largest homeopathy group in the world. I don't think I'm wrong in saying that. The largest number of homeopaths practicing is in India. The larger number of homeopathy educational institutions is in India. And this transition in a very short space of time, how it's been accepted in India and how it is being used. Most recently with the COVID, the pandemics, we have had CCRH, Central Council for Research in Homeopathy, doing many, many trials. Perhaps some of you will enlighten us on the studies that were completed and the results. I don't know if they're published yet, but there are some fascinating results on large studies that are done. Some of you here might know what those results are. Maybe you could share some of it with us. Clearly, the acceptance of homeopathy is very high. The results that are obtained are very amazing. When we look at the clinical trials registry of India, you will find many trials, particularly in this COVID times, that is registered in the clinical trials registry of India. Once again, I will put the link here. So there is a lot happening, and the world outside seems not aware of these things. And that is unfortunate. They don't know what is happening in India in terms of homeopathy, and hope this event and similar events will bring it to the attention of people around the world that India is doing a lot of work. And finally, I want to just highlight one or two of these examples in terms of COVID, arsenic amalgam, arsenic 30C, and several other formulations that you've used. And many of you might say, we have used this and we get good results, but the world doesn't know about it. And we need to find a way to take the knowledge that we have to the outside world and people who can benefit. So with those few words, I want to welcome all of you to this event today. Thank you so much for joining us. And thank you for sharing what you will be sharing as we go through the event. And welcome all. And thanks to Pavanji, Jayesh Thakur, who's here, and all our colleagues who are a source of strength to come up to, as Pavanji says, we are into our 300 plus, 340 plus webinars. And we welcome you all. We look forward to, more than anything, this congregation, the homeopathy congregation. We look forward to your help, strength, vision, encouragement to have this homeopathy element in our platform and to strengthen this as we go along. I hope in one of our future events, we will get Dr. Raj Manchanda, also who's very close to many of you people here. Raj Manchanda ji is now at the Tibia College in Karol Bagh in Delhi. So that shows how different people from different disciplines can take leadership role in different institutions within the Ayush umbrella. Manchanda ji is one excellent example of how somebody who is deeply in homeopathy is looking after Tibia College that has strength in Unani medicine and Ayurvedic medicine. When I finally look at the principles of water and the water memory and how water impacts life, I think you people, the homeopathy world, has the best understanding. And we need to start doing research in this space. Hopefully the clinical evidence will guide us to doing research. So welcome all to this platform. Thank you so much for joining us. And we look forward very eagerly to listening to all that you have to say. Namaskar. Pavanji.
Thank you, sir. I would like to request senior most dignitary of homeopathy, Professor Dr.A.K.Gupta. He is MD Homeopathy, founder director of AKG's OVHAMS, Om Vidya Institute of Homeopathy and Allied Medical Sciences, accredited in Limca Book of Records. Congratulations, sir. Congratulations. And he is a visiting professor of homeopathic materia medica and therapeutics in B.R. Sur Homeopathic Medical College and Hospital, Delhi. Ex-guest professor, College of Homeopathy, UK. Guest physician, Glasgow Homeopathic College, Glasgow, UK. Practicing since 1977. Former nominated member of Homeopathic Advisory Committee and Delhi Board of Homeopathic System of Medicine, Government of Delhi. So he is author of The Problem, Child and Homeopathy. Great, sir. Great. President, Homeopathic Medical Association of India, Delhi State. Ex-President, SDHA. So means long CV, sir. It is just like a lamp before the sun. I'm confessing that this is not my capability to introduce a dignitary like you. Welcome, sir. Welcome on this platform. We will be troubling you again and again on the dates, and please guide us on behalf of homeopathy. Swagatam.
Gupta ji, namaskar ji. Thank you so much for joining us today. Pavan ji, कब तक चलेंगे आज? 9 बजे तक, 9:30 तक?
जैसा आप कहें सर, आज वर्ल्ड होम्योपैथी डे है। नवमी खत्म हो चुकी है, भोजन हो चुके हैं, उपवास खत्म हो चुका है, तो आपकी जय हो।
कारण आज 11 स्पीकर है हमारे, गुप्ता जी हमारे साथ है।
आपकी जय हो। मैंने तो बस
11 लोग। तो we welcome everybody and look forward to your contributions. Gupta ji, thank you so much for joining us. Namaskar ji. Unmute कर दीजिए जी आपका आवाज।
Thank you very much for, Namaskar. Thank you very much for inviting me, especially, and my heartiest greetings to one and all on this World Homeopathic Day. And when we are celebrating the 267th birthday of Dr. Hahnemann, the founder of homeopathy. As Dr. Madan, you have been telling very nicely about the homeopathy, that the vital energy and all that, and what has been done about the, water memory. What the Nobel Prize winner Monteiro also has said about this, that had he been living more, perhaps this paradox would have been a little more clearer to the world, and world would have not been taking it in an antagonistic manner, that the more the dilution, the more the power. But anyway, since the today's topic, what we have been talking about, given is the homeopathy in daily healthcare. So I would like to, can I share my screen, please?
गुप्ता जी बिल्कुल नीचे वो शेयर स्क्रीन पे.
Okay, I'll have to go there.
गुप्ता जी अगले बार मनचंदा जी को भी ले आओ जी इस तरफ दिखाओ जी हमारी.
Zarur will definitely try. And since he's already being the director of Ayush, so he is looking after all the departments, whether it's homeopathy, Ayurveda, Unani, and yoga, everything is there. So he would be, I'm sure he would be very happy to join us and guide us also.
Thank you जी, thank you. डॉक्टर साहब आपका स्लाइड, आपका स्क्रीन तो आ गया है, आपका सेलेक्ट कर.
हाँ. Well, this is what you have sent us. So it's everyone on this is welcome, and my greetings to everyone. Today we'll be talking about.
आपका आया नहीं जी पावर पॉइंट.
आया नहीं?
नहीं, एक बार और करना जी, इसको स्क्रीन शेयर स्टॉप करके एक बार और करना जी.
Okay.
कभी-कभी इस जूम में थोड़ा सा कभी-कभी बीच में अगर कर्सर स्क्रीन के ऊपर ले आओ जी, वो स्टॉप स्क्रीन आ जाएगा, उसमें दबा के एक बार और. हाँ जी, एक बार और करना.
अब आ गया?
आ गया जी, आ गया. थैंक यू जी, बहुत बढ़िया, बहुत बढ़िया.
Well, as I always say, that homeopathy is the one system which ensures health safely and effectively. And talking about the day-to-day life, as you've been talking about what one has to carry on, we talk about health and wellness with homeopathy. And as we all know, that homeopathy believes in mind, soul, and body, which is we call it in a holistic manner. Health is a state of complete physical, mental, social, spiritual, and economic well-being, and not merely the absence of disease or infirmity. As we all know, since at least all the practitioners of Ayush, they do believe in this. And in modern day society, the problem which we've been facing, it is mainly because of the faulty lifestyle and a way of living of individuals, families, within households and societies, which we manifest in coping with our physical, psychological, social, and economic environments on a day-to-day basis. Lifestyle is a composite of motivations, needs, and wants, and is influenced by factors such as culture, family, reference groups, and social class. As we say that, you were telling that homeopathy is being liked by the children because of its being sweet. And it's not only sweet, they get sweet pills to eat and sweet behavior to admire. Because when it is not the only symptom what we, while examining or while taking the reports, when we take up the case, we really, get in touch with the child. We get into the case taking of the child along with the parents, whosoever they are. We take up almost all the aspects, so which brings the child quite nearer to the, physician also. Lifestyle is expressed in both work and leisure, behavior patterns, and on the individual basis in activities, attitudes, interests, opinion, values, and allocation of income. It also reflects our self-image or self-concept, the way we see ourselves and believe we are seen by the others. This is something very important. Like, people, they have got their own opinions about themselves, but they are more concerned and worried about what other people have to say about them. Coming to the lifestyle disorders and diseases that appear to increase in frequency as become more industrialization and people live longer. They can include Alzheimer's disease, atherosclerosis, stroke, depression, arthritis, osteoporosis, asthma, chronic obstructive pulmonary disease, COPD, cancer, chronic liver disease or cirrhosis, type 2 diabetes, heart diseases, metabolic syndrome, chronic renal failure, and obesity. These are a few, common lifestyle diseases. And when we say in this, you can say the pictorial is cancer, diabetes, heart problem, and physical inactivity, smoking, unhealthy diets, other NCDs, chronic lung disease, cancer. They all are, coming under this tree. What causes these lifestyle disorders or diseases, and what actually we are living with? Because the more and more people are drifting away from the nature. They are going more into industrialization, more into, rat race, running rat race, becoming more commercial, and having sedentary life, having much more stress to compete with their, colleagues, or in the race of completing their targets or achieving their targets the sooner, because the people have got more to look forward. They want to achieve faster and quicker. This has become the law of nature nowadays, which has been causing a stress, causing a problem, and they are drifting from the nature, and the nature is taking a toll in giving them one kind of a disease or the other. Like when you have because of trees are being cut, there is a lot of urbanization, carbon dioxide is being there, which causing more problem to the breathing and leading to the angina, asthma, anxiety, panic attacks, and genetic dispositions. All are there because of the modern days things which we are living into. And if we see this, in the chart, the chronic illness comes, takes the diabetes is 2020 has been the highest respiratory disease, asthma, COPD. And this shows you that, the chart from 1990 to 2002 to 2020. This has been the, graph which has been increasing ever since. And injuries and communicable diseases are comparatively has slowed down a little bit, because the communicable disease are little lesser, and injuries because of the safety measures and other these things have come up, so has reduced. There have been a couple of, as we say, what are the, you've been talking about what we should do in day-to-day life. There have been 5 steps to a healthy lifestyle, which we keep to get up at, at early morning for each day, eat fewer snacks and select healthier alternatives, choose water as a drink, eat more fruits and vegetables, turn off the TV or computer and get active. In what this I'm talking about is really very, very difficult in today's time. And on the contrary, 2 years before, we used to ask the children not to get hooked to the mobiles or increase your screen time. And unfortunately, ever since the corona came and everything became, online. So wanting or not wanting, we parents had to give the, mobile machine to the children, and they've been using it, misusing it, and abusing it also. And the moment anything which has been useful, if it is being misused or abused, it does have its own repercussion on the health of economy of health of the person. A common eat less sugar, you are sweet enough already. that's I mean that's what we call, like, I mean, if you I mean eat sugar, it is not really going to make sweet that, but if you really think sweeter eater, I mean, for the people, for the benefit of others, and in the terms of humanity, that sweetness would be much more desirable by anybody and everybody rather than having pure sugar. It is not that diabetes, heart disease, and obesity runs in your family. It's that no one runs in your family. This is what the things were told at a time when people were more busy in having their career-oriented, career-conscious, and living into their kind of competitions and giving up the basic physical activity, exercises, walk and run, that has been almost forgotten to, I mean, a particular generation. So those were the people who became more prone to heart disease and obesity. Heart disease before the age of 80 is our fault, not God's fault, or nature's will that was sent by Paul Dudley, White, MD. And as we, I mean, in Ayurveda and in Ayush, we do believe in towards the nature. So these are the 6 best doctors: water, fresh air, rest, exercise, good diet, and good sleep. A person who can have this in a very modified manner, optimum manner, he would very less likely that he would be require a medical doctor. Now let's talk about homeopathy. At homeopathy, as you all know, it's a basic principle is similar similibus currenta, which means let like be treated by likes or let like be cured by the likes, which was founded by Dr. Samuel Hahnemann, a great German doctor in 1796. And incidentally, I'm very happy that we are holding this webinar on this auspicious day of World Homeopathy Day, when we are celebrating 267th birth of Dr. Hahnemann, the master of homeopathy. As Dr. Madan was saying, that homeopathy is a recent one in the form of Ayush. Well, yes. Well, it is not that, it is not all that new, but it's been already more than 230 years now. Yes, in India, it came in 1853. When Maharaja Ranjit Singh was the first person who was treated by homeopathy. And even Hippocrates, the father of medicine, had talked about the treatment from similars, but it was eventually Dr. Hahnemann in the 18th century who coined and discovered the word of homeopathy. And as Dr. Osler says, who's the father of modern medicine, says the maximum benefit has been given by Dr. Hahnemann to the medical world. These are the words of Dr. Osler, who had been considered as a father of modern medicine. It is the second fastest growing medical system in India or all over the world. Most gentle and harmless mode of treatment with no side effects. It roots out the disease from the body. It is as potent in acute and emergency cases as it is in chronic diseases. It can prevent surgery and cures the person completely. It is not that, each and every case which is required the surgical intervention, but yes, there are quite a good number of, patients and conditions where surgery can be completely avoided. Very few people would need the skill of a surgeon if they've been treated with homeopathy right from the beginning. For example, cases of sinusitis, piles, fissures, and tonsillitis. These are a couple of things where surgery can be totally avoided if the constitutional proper homeopathic treatment is given. The patient would not require the surgery at all. Even the cases of there've been fibromas and tumors, small tumors. Even the cases of where people have been going in for surgery like breast tumor and all that. They also can be treated off with homeopathy. Not each and every case. Of course, we need to see and screen the case. It has the power to cure the so-called incurable disease also. And I would be feeling very delighted that I'm treating a great number of cases of one rare disease and very difficult disease, that ALS and motor neuron disease. And I'm treating more than 600 cases to my record, where we have been able to slow down the progression of the fast progressive degeneration. In many cases, the degeneration has completely stopped. They have been stable, and they have been able to improve their quality of life. And in few of the cases, even the lifespan has also been helped to increase. The medicine in terminal and irreversible stages of disease like cancer also, it helps. Homeopathy acts as preventive and also minimizes and removes the bad effects of vaccination, chemo, radiation, etc. And as we were talking about the COVID, we have got, and as I was telling about the patient who has been undergoing treatment for ALS or MND, they've been improving tremendously. And after taking the vaccination, the problem had got worsened. So there had been an ill effects of vaccination on those. So we had given them the patient, to counter the action of vaccine, and they have, recovered to that particular position again. And as we've been talking about, tonight itself, I've got another, webinar with the IFHP, where we are going to talk about the post-COVID, complications and homeopathy. So I would, rather like to take an excuse, because at 8 o'clock I have to be there also. Research in disease like motor neuron disease and AIDS has brought some encouraging results with homeopathy. Of course, cost effectiveness when compared to any other system. Role of homeopathy in treating lifestyle diseases. People who have, take homeopathic treatment medicines which are given on basis of complete physical and mental makeup of the patient significantly delay lifestyle disorders like diabetes, obesity, and hypertension. This is especially significant in cases with a family history of hypertension, dyslipidemia, and diabetes. Diagnosed cases of hypertension can be well managed with homeopathic remedies, provided medicine is prescribed on the constitutional totality of the person and not specific disease-based symptoms. Disorders like hypothyroidism, early diabetes, depression, mood disorders, which are most common these days, in urban areas, can be controlled very well with homeopathy without any side effect or fear of dependency to a drug. The benefit of homeopathy is that when a person takes the right remedy, not only does the disease being targeted is cured, but the overall immunity of the person is also boosted, and their tendency to any other disease they are susceptible to also reduces. We have seen in many cases when a patient has come for one particular disease and he talks about one particular problem, and when we have given him medicines on a constitution basis, and after some period of time, he feels very surprised that the complaints which he has never even mentioned has also been treated off and taken care of. That's the beauty of homeopathy. Patients become less prone to diseases and infections, and their stress management improves drastically, in the sense that that triggers which increase the stress will no longer cause stress, and people remain healthier and stress-free. Similarly, obesity, also a major health concern in India, is an issue which requires management at multiple levels with homeopathic medicines combined with lifestyle changes. The basic metabolic rate of the body can regulated and obesity kept at check. If along with homeopathy, people make minor alterations to their lifestyle, then disease can be kept at bay for a very long time and they can live much healthier and longer. The earlier one starts on homeopathy, better are the results for the same. Children who grow on homeopathy live much healthier lives and are less prone to diseases and have less absentee from school due to the illness. Some glimpses.
In brief, sir, in brief.
But okay, sir, but now just, I mean, I won't be going further details. So these are the cases where you can see that homeopathy has run really wonderful results. Epidermolysis bullosa. I mean, this is psoriasis. This is vitiligo. This is atopic dermatitis before and after. And this is, of course, alopecia areata. And this is nephrotic syndrome. And this is herpes zoster. And this is acne vulgaris. And with this, I think I would like to say thank you and for giving me an opportunity to talk and share my views with you with the August gathering. Thank you very much.
We are blessed with you, sir. We are blessed. We are blessed. Madan, sir.
Thank you, Gupta ji. We are so happy that you have managed to spend a little time with us today and share your knowledge and experience so succinctly, that you've shared so much here in a very short space of time. I'm taking the liberty of asking one or two small questions, sir, just to, because it is difficult to catch people like yourself, and I know you might not stay till the end of the program because you have to go to
yeah, for the other one.
Shaji Kudiyat's program.
Yeah.
Very happy. Sir, you had mentioned a very interesting thing, 1853, Ranjit Singh ji. Is this Ranjit Singh ji of Jamnagar? Is that the same?
Maharaja Ranjit Singh, yes.
Of Jam. Oh, this is interesting. I didn't know this fact.
Vadodara, sir.
Acha, we will find out.
Gaikwad from Vadodara.
Acha ji. Dr. Sahab, the other thing you mentioned, which is very exciting, 600 cases of ALS.
Yeah.
This is quite amazing. We would love to learn a little more. I don't know if you have published anything about it. Or
well, I have given, international webinars on that, numbers of them. I've been presenting my papers in almost international conferences.
Right.
But yes, if you wish, we can have a, special complete session on that.
I think Pavanji will request you to join us at a later date on an appropriate day when we can discuss this motor neuron disease in particular.
Sure.
So the other thing that you mentioned, which was interesting, was increase in cardiovascular disease in one of your posters. I won't go into this, but finally with acute care, the one example I want to present to you is Arnica 200C for hemorrhagic strokes.
Yes.
And I think I can see many people nodding here for Arnica 200C. And in our family, we have a family, my mother's cousins, many homeopaths.
Very
and
nice.
there, a senior homeopath, principal of a homeopathy college, had a stroke and
nice.
Complete recovery with Arnica 200C. So this is knowledge that you people have, but I find it difficult to understand why modern medicine and stroke units don't keep some, what is the reason for this, sir?
Well, it's a very unfortunate part that, to tell you honestly, I have been treating a number of allopathic doctors and their family members. And not all, I'm not saying all, but many of them, when any patient talks to them about whether they can go for homeopathy, and then they have got a very indifferent attitude. They say, we do not know, what will they say, because this is either because of the ignorance of the, efficacy of the other system medicine, or it is their particular, what you call attitude or strong-headedness, or superiority complex, whatever it is. But this is the most unfortunate part. Honestly speaking, if you see that, I'm founder director of IRES OVM. There's a very good story, real story, behind it. If the time permits, I can just give you a small. I had in my early days of practice, I got a case of thyroid. So I asked that lady to please get the test done, and it appears to be thyroid. So she said, I'm talking about, around late 70s, early 80s, 70s, when the test was not readily available in each and every labs. That time, there people used to go to, Timarpur, when there was a INMAS was a center, and it used to take almost a month to get the report. So, but that lady said that my husband, he's a Lions Club, president, and they've got a tie-up with the All India Institute of Medical Sciences, so they can get the test. And I said, wonderful, this because AIMS is already a well-known, reputed place. So the patient went there, and the doctor who saw her took up the case, and then he said, it looks like a cancer. And she was worried. She came back to me in the clinic in the evening, and she said, Doctor, you were saying that, but they're saying cancer. I said, I keep my fingers crossed. I do not know. It's on my early days of practice. I also got rather, shaky. Sure. But still, they said, you come and the report, you'll get the report within 3-4 days. And in 3-4 days, in that particular family, they could not have a proper food because she had 2 small children and to look after, and the husband. And you can understand that the situation way back in late 70s and early 80s. So when she back again to get the report, they said, okay, it's not a cancer. This is thyroid. So you need to take this medicine and take this medicine for 10 months and come after that. Then again, she came back to me because allopathic medicines were not suitable to her. So she said, can you treat homeopathic? Treat me properly. I said, yes. And after a couple of months, 4-5 months, she became completely symptom-free and all that was okay. And that was the time when she, started becoming a little irregular with the medication. This is as a human nature. Jab theek ho jata to, thoda wo ho jata. Then she said, we'll get the test done. She got the test done, and they said, it's absolutely fine. Take those medicines which you are taking, for another 10-15 days, and then stop it. And then that was the time when that lady told the doctor, but I never took your medicine. I took homeopathic medicines. and this was really shocking. That same doctor said, nahi wo kai bari apne aap bhi theek ho jata hai. Now, imagine the situation. Once you are telling the patient it is a cancer, then you are taking the then 10 months medicine. अगर और अभी भी ठीक हो गया तो take 10 days medicine, then stop it. और अगर बिना उसके homeopathy ठीक हो, then it becomes that was the time I thought that we should have a place where the people's welfare should be the main aim, patient welfare, not homeopathy or allopathy. So that was the time I started this Om Vidya Institute of Homeopathy. That was the first center of integrated system, and you can say in that case I've been a pioneer in that to integrated. Dr. Chowdhury, who was a director of health service, came to my center, liked that idea. After that, he started opening homeopathic dispensary and Ayurvedic dispensary in all allopathic hospitals. That was the time. And after that, it came Ayush. So that's another part of the story, but this is how it happens.
So we are so lucky that you are here with us today. And I know we have changed the format just because you have to go to another event. There might be 1 or 2 quick questions. Hamari taraf se ji, bahut bahut dhanyawad.
Thank you very much. Thank you.
I also feel, I just want to add here, कि यहाँ पे Europe में जी, there is this antibiotic microbial AMR, antimicrobial resistance. There is a big problem. They are trying to find alternative ways. In the Netherlands, there is a lot of success on using homeopathic remedies for animals. That is a very important thing. Second thing, Ji, I think in Delhi, people like yourself and All India Institute of Ayurveda, All India Institute of Medical Science, and Tibia College, I think we must come together. Kam se kam ek cheez that they must learn from the homeopath is case taking. It is so amazing that your approach to case taking is so wonderful. I think all medical students must learn this. It doesn't matter which discipline, and we will discuss this. We will discuss this, and Pavanji, we'll find a platform where we can discuss this.
Sure.
Last, I think Harish Ji from Toronto is turned his camera on, so maybe he has one short question. Harishji,
Sure.
Namaskar. Harishji is our
Question and answer. If question and answer will be in last, sir,
towards
it
the
is
end,
my
but I think
humble request.
Guptaji is
Humble
leaving
request.
us to go to a second event. So
Yes, yes, Harish Verma ji, please. Harish Verma ji, please.
हाँ जी, मेरा एक छोटा सा सवाल है गुप्ता जी से कि
जी.
I have seen he has treated 600 patients of ALS. उसमें क्या एक ही मेडिसिन थी या मेडिसिन पेशेंट के अकॉर्डिंगली चेंज होती चली गई है?
Yeah, that is the beauty
My
of
humble
homeopathy.
request, sir, to avoid the disturbance in flow, we can arrange question answer session in the last.
No, that's the beauty.
Guptaji will not be with us to the end, so we will just take this one quickly.
Sure. That's the beauty of homeopathy, that we treat the patient as an individualistic approach. Like in allopathy, they have got every patient is being treated with Raluzol or Ralutol, that is the medicine, or they are asked to go in for treatment of Adavarone treatment or the stem cell. Other than these three, they do not have any treatment for any patient. All patients are being treated by the same medicine, whether it helps or it doesn't help. And the unfortunate part is, simultaneously, when they do not have any treatment of their own, they say there is no treatment in the world, and you have to just apna bhajan karo, wo karo. So that gives such a bad impact to the patients and the attendants of the patient. कि वो एक बिल्कुल जो predetermined death होनी शुरू हो जाती है. But in our case, we treat the patient as individual, and we try to take that, as you were talking about the case history. I have found it very important in my research that all these patients they've been very, principle-oriented people, and they have got some time or the other, they've got some injustice in their life which has affected. And on that basis, I've been treating patients, giving the constitutional treatment. Medicines like Ignitia is there, Staphylococcus aureus is there, the different. So no, all patients are not being treated by the same medicine. That's, which I would like to talk to Dr. Harsh Verma.
Guptaji, thank you so much.
Thank you very much.
We will draw this. Just because you are going to Shaji Kudiet's program, we stop this one here.
Right.
But Pavanji will bring you back on special events related to neurological conditions, and Harishji's connection. Harishji also runs a clinic in Delhi, so we will arrange something.
Sure. Right.
Namaskar ji. Thank you so much for sharing your time with us, and thank you for sharing insights.
Bye-bye. And do excuse me for, I have to
Thank
go.
you.
Right.
We appreciate, and we are very grateful you joined us and shared this wonderful presentation.
Thank you, sir. Thank you
Pranam
very
ji.
much.
Thank you. Thank you, ji. Thank you. Pavanji, all
Yes,
yours.
Now I would like to request other dignitary from UK, Dr. Nikunj M. Trivedi, who was born in India, Gujarat, and presently in England. From London, UK, he was honored as a fellow by HMA UK and fellow of British Institute of Homeopathy. Practiced homeopathy since 1980 with full-fledged homeopathy indoor hospital in India till 2004. He was affiliated with various homeopathic colleges in Gujarat, and with his vast clinical experience in gynecology and obstetrics, he practices in infertility, covering both male and female problems. So without wasting much time, because speakers are
Many.
blessing us in more numbers. So please.
Thank you, Pavanji. So
Dr.
we
Nikunj Trivedi
will not disturb
welcome.
any more with questions. All questions to the end. Please put your question in the chat box. Pavanji, just
So
because
nice of
Guptaji
you.
was
So
leaving
nice of
us.
you. So nice.
Thank you, ji. Thank you. Tripathi ji, namaskar.
Namaskar.
Dr.
Namaskar.
Nikunj.
Dr. Nikunj may be in problem because there was a power failure in Leicester. It's very surprising. It never happens in UK. But today he just sent me the text message. There's a power failure.
Sorry for
I
this.
think he is trying to reconnect.
So perhaps we can move to the next speaker. Pavanji.
Yes, sir. Yes, sir.
I can see Nikunj's message here. There was a power failure here. Sorry for disconnection. Harish ji, namaskar ji. Thank you for asking.
I am requesting Dr. Shashi Mohan Sharma ji first joined. Thank you for early joining, sir. Thank you very much. We are obliged. And Dr. Shashi Mohan Sharma ji is principal of Anirban College of Homeopathy, Slough, UK. I couldn't pronounce right, I hope. Welcome, sir. Welcome, sir.
Namaskar ji.
Good evening, everyone, and good afternoon in United Kingdom, and good morning to Dr. Verma Sahib in Canada. It's very good that we are all together. We are like a family of Hahnemann and homeopathy, and I feel very, very excited when I see these type of events, because we are the best in the world. We means India, homeopathic doctors are the best in the world. I always go everywhere and say this because we are totally dedicated. Other doctors from Pakistan and Bangladesh are very good as well, but the dedication of Indian homeopathy is supreme. So my suggestion is to follow Hahnemann as he instructed in the chronic disease and philosophy. We are just saying that we are homeopath. Most of them are not practicing homeopathy as it was instructed by our master Samuel Hahnemann. I feel very sad when I see the people are taking a very shortcut methods and prescribing homeopathic medicine, and there are some failures. Mostly there are failures if you're not taking a proper case. We must take a case very proper, cool, and in full. From head to toe, all symptoms must be recorded, and special consideration should be given to the characteristic and peculiar symptoms which leads to the remedy. So I know all of you are very learned and you are practicing homeopathy. I wish you the best for your future. Please follow master's instruction and practice homeopathy. That's only I want to say. I'm more interested in learning and listening to others, because what I know, but what my other friends are going to tell about homeopathy, I will definitely enjoy. Dr. Madanji and everyone, I'm more interested in listening what are others' views on homeopathy. So only suggestion is, please follow the master's instructions and do the proper case taking, proper similmum. Proper homeopathic treatment is the one of the best that will never fails. That's my saying today.
Thank you, Jin. Thank you.
Good to have organized Dr. Sharma ji from Kolkata is doing, Pavan ji is doing a lot of hard work, and I wish you and everyone every success in their life. Thank you very much.
Shashi Mohan ji, thank you so much for being with us today.
You're welcome.
We wish your guidance, inspiration for this platform to take forward the homeopathy aspects of this platform. As in future programs, we will come together. You will see from our archive, I put the link to our archive. All these events are recorded for anybody to view at any time. And you will see from the archive the events that we have had. And Pavanji will keep inviting all who are here and your friends, your colleagues who are working in this space to join us and to keep and strengthen this platform for the future.
Thank you very much, sir. And I hope everybody is enjoying Hahnemann Day, Homeopathy Day. And definitely we will be together for the cause of homeopathy, and definitely we'll work hard and keep the mission of the Hahnemann going. Thank you very much.
Thank you, Ji. Thank you so much for being with us, Pavanji.
Before calling Dr. Nishant Tripathi, sir, I would like to request Dr. Harish Verma ji, as he is about to leave, for his valuable blessings on the platform. Dr. Harish Verma from Toronto.
सर प्रणाम, सभी आचार्यों को प्रणाम। मेरा एक सवाल एक्सपर्ट से है, सभी होम्योपैथिक एक्सपर्ट से, कि काइंडली वो बताएं कि होम्योपैथिक मेडिसिन में जो एक्टिव मॉलिक्यूल होता है वो बहुत कम होता है, जो मैंने आज तक समझा है। The lower the active molecule is, more stronger is the medicine. ये मेरी एक धारणा है। तो वो बिना एक्टिव मॉलिक्यूल के वो मेडिसिन कैसे इफेक्टिव हो जाती है, थोड़ा इसके बारे में बताएंगे। थैंक यू सर, थैंक यू।
I don't know, this is a बहुत मोटा सवाल है जी, हरीश जी। शायद हमारे साथ है अमजद
देखिए
इकराम जी।
इसके ऊपर तो टाटा ने जो बताया है मुंबई में, वी आर द आई मीन बेस्ट इंफॉर्मेशन वी हैव फ्रॉम नैनो होम्योपैथी जो उन्होंने बनाई है।
हाँ जी, हाँ
ये
जी।
मॉलिक्यूल्स जो हैं ये बहुत ज्यादा सुपर एक्टिव होते हैं। दीज आर रिमेनिंग 30%। कई लोग जोक बना रहे हैं 1 drop of water in the ocean and all that, but they don't know the dynamic power of the medicine. Most of the medicines have got the dynamic power and they work on the spiritual, I mean, basis, not on the material basis. When we make Nux Vomica 1x, 2x, 3x, it is giving more power to the medicine. First of all, we should know what is the difference between the drug, medicine, and remedy. The drug is any substance which is capable of altering man's state of health. And when these are prepared, then these are called medicine. When a particular medicine is selected for a particular case, that is called remedy. Remedy also means solution. So it is not now, it is, there are so many doctors that are going, what is there is a simple water, is a simple alcohol. But if it is a simple alcohol, then how it will work? I have seen the result of Pulsatilla 200 within 30 minutes. A gentleman came to me and he is a big personality in the United Kingdom. And he said, I am recommended by someone and I am having the blockage of nose since long time. And we are the builders and we do this and that. Okay, okay, tell me the symptoms. I asked the symptoms, I took the case taking, and definitely all the characteristic symptoms. Don't like hot, don't like room, they want fresh air, aggravation in the evening. Everything was Pulsatilla. So you will be surprised what I did. I said, how long are you suffering? He said, I'm suffering more than 1.5 years. So I gave Pulsatilla 50 m, 2 doses. And then he keep asking me, when I will get better. I said, don't worry, open the mouth and put one powder in the mouth, and second powder was on my table. I made 2 doses because sometimes you make one, then maybe spilling or something. So I gave one powder direct to his mouth and I keep chatting with him. So how was this? How was that? 10 minutes gone, 15 minutes gone, 20 minutes. Then I said, he keep asking when I will get better. I said, okay, I tell you, don't worry. And after 20 minutes, I asked him, Mr. Singh, how you're feeling? You know, he's a Punjabi guy, and Mr. Singh, he abused his nose with dirty Punjabi abuse and said, oh, mera nak khul gaya. What is this? I said, okay, give me another dose. I said, you don't need another dose. One is enough. The same thing happened with Dr. Kent. When he took his wife Clara for the insomnia, the one dose treated Dr. Kent's wife, Clara Louise Kent. So here we do the mistake. When the action of medicine is done, that's called primary action. We keep giving medicine, and it is just like a ball going and coming, ball going and coming. There the case is spoiled, the body is confused. We should select a proper remedy and single dose in high potency. I used to give Nux Vomica in the bottles about 30-40 years back. I was a new homeopath. I knew I was doing wrong, but slowly, this year I'm going to complete 50 years of homeopathy, and I'm so happy. So give a single remedy of the high potency and then see the result. Another thing is people are giving remedy, but remedy is right, but the potency is not right. Another case of belladonna, I gave a person who was very violent and sleeplessness and red face and everything, muttering, murmuring, delirium, everything is a young boy, about 16-year-old. He was not sleeping, he was biting, he was breaking things, and it was proper case of belladonna. So I gave 200 potency, just my potency, which I always recommend myself. 200 is the best. My teachers used to say, start with 200. And it didn't help. So rather than changing the remedy, I changed the potency to 1 m. I gave 1 dose of 1 m, and the same night, the guy slept for 3 hours. And next morning, he was different. Now the parent is saying, give me more. I said, no, wait. I'm not ashamed of telling that I used Kali for 6x, for another remedy for continuing, because they want to take some medicine. I don't want to give belladonna. or Saclac or simple pills. So I said, carry on Califas. Within 7-8 days, the guy was sleeping full night and his behavior changed. And after 3 months, he was completely normal. Going to school, no fight, nothing, no breaking. The parents were saying, thank you very much. I said, don't say anything. Say thanks to homeopathy and say thanks to the Master Hanuman who gave us this special knowledge. I am never, I mean, confused. I am never frightened of taking any case. Even a single symptom will lead you to the different, I mean, directions. If somebody is saying, I have got this thing, and they don't know the value of that symptom, the symptom is not complete until we go for onset, location, sensation, modalities, and commitment. They only know when we are asking what type of weather you like, how much you drink, how you sleep, how much you eat, desire for salt and sweets, and moods and behavior. They are confused because they don't know what is homeopathy. We know homeopathy. So we should not listen to the patient. We should listen to the master's teaching. Take full case taking. I am remembering one case of 1967, 15th of August. I want to share with you. That day, we were celebrating Independence Day in Lucknow Medical College. One of my classmates was Khalilullah Khan. He had suddenly pain in the tummy. He was on the ground with a bending double and everything. So one of my teacher, Dr. Muhammad Ishaq Hussain Qureshi, called me, come, just go and bring this medicine. I went, that day we were working, we work 7 days in that dispensary. I have the medicine and one dose. In within 4 to 5 minutes, he stood up and said, sir, what you have given me? I was using Baralgan injection. I was going this, I was taking that medicine. Sir, you saved my life. And that medicine was colosynthesis. So that was our first experience, live experience. And the teacher, one of the best teacher of Materia Medica I know. So we have to go through Materia Medica, whether we need it or not. We should go through the books all the time. We should study. It's no good of wasting time here and there. Read Organon of Medicine. Read Materia Medica, most important. And third one, most important, is the repertory of homeopathy Materia Medica. My favorite book is the Dr. Kent's repertory. Now Dr. Murphy's book is there, others are there, but I always prefer Kent's repertory. And Dhonigasan, second one. So I should not go too much because my dear brother, Dr. Nikunj is back. Doctor, electric.
I can see okay. Nikunj is here with us. Shashi Mohanji, thank you so much. One quick, I think.
Sir, we should call Nikunj.
For everybody, you can add to this. And Shashi Mohanji, thank you so much. And one last question. I am assuming you studied in Lucknow, ji.
I studied Lucknow from 67 to 72. And for your information, and I'm so lucky that I was the youngest student of my college in 100 years.
Dr. Saab, this is the National Homeopathic Medical College and
National
Hospital.
Homeopathic Medical College and Hospital. The minimum age for admission is 17. And when I went there and they saw my application, he said, oh, you're not even 17. I am born on 20th August 1950. And that was, interview was in July. He said, oh my God, you're not. What you will do? I said, I shall come next year. Then he said, not next year. Then I said, next to next year. They will, this bloody, he's very adamant. Give him admission.
Dr. Saab, thank you so much for being with us today. I hope you will stay with us for the rest of
I'm so happy to see all of you. And I know you are doing very good for homeopathy. Everyone who is listening to me, have a nice time ahead. And I am enjoying I am waiting for my dear brother Nikunj lecture next time. Thank you very much. Dr. Sharma ji, thank you very much. Pavan ji, organizing this event, and Dr. Amita Arora ji, very, very hardworking.
So nice of you, sir. So nice of
thank
you.
Thank you. I'm enjoying it. You made my day.
Thank you, ji. Thank you for
Dr.
being
Tripathi
with us.
You made my day, all of you.
Thank you so much for sharing those few stories.
Take care, and I hope you're enjoying.
Thank you, ji. Thank you. I hope you will stay with us as long as you can. So that
Sure.
You can
I
listen.
have to go in 20 minutes. I have to go in another event.
We will have you. Pavanji
Up
will
to
bring you back on the
7.
platform for future events. So
Up to
thank you.
Up to 6:30, I am with you, sir.
Thank you. Thank you, Ji. Thank you.
Thank you.
Shashmohan Ji, thank you so much. And thank you for introducing Lucknow to us once again. Namaskar,
Thank
Ji.
you. Thank you.
Namaskar.
Namaskar.
Pavanji, I think
We would like to call Nikunj.
Nikunj Ji.
Dr. Nikunj has joined. After that, I would like to request my younger brother, Dr. Nishant Tripathi ji. But now Dr. Nikunj has joined.
Pavanji, लगता है कट गया निकुंज जी का.
Yeah, there's some problem in Leicester. It never
हाँ
happens
जी,
in the United Kingdom. I don't know why it is happening today.
निकुंज जी का कट गया लगता है. I think we've lost him again. He was here just now, but we have
Yes,
lost
I
him.
can see. I was just looking at
Yes.
him.
So I am again requesting Nishant ji. He is marketing head and really dynamic fellow, doctor, and then completely heading a marketing division of reputed homeopathic company in Calcutta. Welcome, welcome, Dr. Nishant.
Nishant ji,
Welcome.
namaskar. Nishant ji.
Namaskar. Thank you so much for inviting me. मेरी आवाज आ रही है?
हाँ जी, बट मगर थोड़ा सा ढीला है जी आपका आवाज. पता नहीं, वो लगता है आपकी बैंडविड्थ थोड़ा कम है.
मैं ट्रैवलिंग में ही हूँ, दिल्ली में ही.
हाँ जी.
तो सबसे पहले आप सभी लोगों को डॉक्टर हैनीमैन के बर्थडे की शुभकामनाएं. और ये जो बर्थडे हम सेलिब्रेट करते हैं, हर बहुत सारे लोगों का हमने एक्सपीरियंस सुना, बहुत ही रोमांचित करने वाला था. रियली इट्स मिरेकल ऑफ होम्योपैथी. साथ में मैं कुछ थोड़े पॉइंट ही कह के और अपनी बात को समाप्त करूंगा. डिजीज प्रिंसिपल्स ऑफ होम्योपैथी के साथ बहुत अच्छा हर एक तरफ रिसर्च भी चल रहा है और लोगों का एक्सपीरियंस भी शेयर हो रहा है विद मोड ऑफ एक्शंस. बट होम्योपैथिक में मेरे हिसाब से कुछ और चीजों को थोड़ा ऐड करना चाहिए. जैसे कि डॉक्टर हैनीमैन ने अपने टाइम में जो प्रिंसिपल्स ऑफ होम्योपैथी है उसको 6 टाइम अपग्रेड किया था. दैट इज ऑर्गेनल ऑफ मेडिसिन. 5th edition he was published and 6th was wrote and thereafter he was passed away. So after a long gap of time it was published. That was 6th edition. In homeopathy I've seen a lot of followers who are following, but homeopathy needs few creators also, because the time came we should think about the 7th upgraded edition of organ of medicine for the homeopathic fraternity, जिसमें क्या अपग्रेडेशन आए और इसमें गवर्नमेंट का भी सपोर्ट चाहिए, साथ में इंडस्ट्रियल सपोर्ट भी चाहिए. दोनों के सपोर्ट से ऑर्गेनल ऑफ मेडिसिन जो प्रिंसिपल्स ऑफ होम्योपैथी है उसका अपग्रेडेड वर्जन भी आ सकता है. सो डेफिनेटली क्रिएटर्स की बहुत जरूरत है जो कि कुछ नई चीजें इस फील्ड को दे सकें. और मैं ये चाहूंगा जैसा डॉक्टर शशि मोहन शर्मा जी ने कहा कि most acceptable repertory is Kent's repertory. Those who are homeopathic doctors, they must know, and I think maximum of them are following the Kent's repertory. Dr. Kent, उनका बर्थडे मैं चाहूंगा कि नेक्स्ट ईयर से उनका भी बर्थडे सेलिब्रेशन में आए. दैट इज 31st of March. बस 10 दिन पहले 31st मार्च को केंट्स का बर्थडे भी हम लोग सेलिब्रेट करें नेक्स्ट ईयर. तो एक बार केंट का भी सेलिब्रेट करेंगे, उससे भी काफी बातें होंगी. तो ये एक होगा कि अभी सिर्फ डॉक्टर हैनीमैन का हम बर्थडे सेलिब्रेट करते हैं, डॉक्टर केंट का भी सेलिब्रेट करें, डॉक्टर सी हेरिंग का भी सेलिब्रेट करें. तो साल में अपना इंटरवल्स पे कुछ और सेलिब्रेशन करेंगे. तो हम केंट के बारे में, जैसे डॉक्टर शशि मोहन शर्मा जी ने, मुझे बहुत अच्छा लगा डॉक्टर केंट की वाइफ के ट्रीटमेंट के बारे में बताया. डॉक्टर केंट होम्योपैथिक में कैसे आए? एक्चुअली ही वाज नॉट इन द फुल फ्लैश, ही वाज इन होम्योपैथी, बट उनकी वाइफ का ट्रीटमेंट हुआ सेकंड वाइफ का. उसके बाद से वो होम्योपैथिक में आने लगे, फिर लेक्चरर भी रहे और काफी कुछ दिया. उन्होंने जो मैगजीन एक पब्लिश किया था उसमें वो एडिटर थे. दैट वाज, मैं आज अनाउंस करता हूँ, नेम शायद बहुत सारे लोग जानते होंगे. दैट वाज द होम्योपैथिशियंस, homeopathic physician, that is homeopathicians. And I had a plan with an organization to republish the homeophysicians from Calcutta. क्योंकि कैलकाटा में एक कंपनी है कैंट फार्मास्यूटिकल्स, उनसे हमारी काफी बात हुई और वो भी एग्री हैं कि जब कैंट के प्रिंसिपल्स पे कैंट के साथ डॉक्टर हैनीमैन को फॉलो करते हुए वो मैन्युफैक्चरिंग कर रहे हैं, तो द होम्योपैथिशियंस पब्लिश करें क्वार्टरली, बाद में इसको और मंथली भी कर लें। तो इससे क्या होगा, डॉक्टर केंट का भी नाम थोड़ा हर तरफ बढ़ेगा। तो डॉक्टर हैनीमैन का बर्थडे, डॉक्टर केंट का बर्थडे और भी डिफरेंट जो रिनाउंड होम्योपैथ्स हैं उनके बारे में सेलिब्रेट करें, तो उनके बारे में हम बात करेंगे तो आने वाली जनरेशन उसके बारे में जानेगी। और मैं फुल फ्लैश डिवोटेड हूँ फॉर द प्रमोशन ऑफ होम्योपैथी। किसी के कोई भी आइडिया हो दे कैन।
निशांत जी कट गया, आपका आवाज कट गया। निशांत जी आपका आवाज।
with the support of government आयुष मिनिस्ट्री, जिसकी प्रोफेशनल एक्सपर्ट में था, मैं साइंटिफिक कमेटी में फिर से रिकॉन्स्टिट्यूट हो रहा है, वो मे भी जुलाई तक वो कॉन्स्टिट्यूट हो जाएगा, तो फिर से एक्टिविटीज स्टार्ट हो जाएंगी। और कुछ इंडस्ट्री के सपोर्ट से एक जर्नल ऑनलाइन एंड ऑफलाइन बोथ इसको शुरू करें। तो ओवरऑल माय overall observation is just we have to think about something new, that is creation in homeopathic field. Thank you so much for listening me. Thank you.
निशांत जी थैंक यू सो मच। हमारे साथ है निशांत जी आज इटली से विंचेंसो
निकुंज जी जुड़ चुके हैं सर।
हाँ जी,
निकुंज जी जुड़ चुके हैं सर।
निकुंज जी नमस्कार जी, नमस्कार, अनम्यूट कर दीजिए जी। हमारे साथ है विंचेंसो वैलेंसी इटली से। वी विल डिस्कस ऑफलाइन। निशांत जी अगर आपके टेलीफोन नंबर थोड़ा भेज दें हमें चैट बॉक्स में, देन प्लीज। वहाँ मिलान में एक कंपनी है जी गुना इंटरनेशनल, उनके साथ दे आर इंटरेस्टेड इन सम इंटरेक्शंस विद ऑल ऑफ आवर पीपल इन देयर। निकुंज जी नमस्कार।
नमस्कार सर। नमस्कार।
आपका कनेक्शन कैसा है जी? लगता है
अभी
आज
तो मैं अपना पर्सनल हॉटस्पॉट से आपसे मतलब की बात कर रहा हूँ। There is no light.
Please continue, sir. The floor is yours. We look forward to. This is very unusual that there is a power cut in Leicester, but thank you so much for joining us.
Yeah, because of some road works and everything is going on. So yeah, they must have given notice, but I don't know what has
Sunday
happened. But anyway,
they will be doing something. Thank you.
Okay, sir. Regarding the homeopathy and its miracle, let me share my experience with the infertility. I'm in practice since 1980. I was working with a renowned gynecologist in our area. I witnessed many cases, and when he brought a shot of a new laparoscope in his hospital, and we were doing a laparoscopy of the patient. With the laparoscopy, we used to use a shot of a methylene blue, and when we were inserting that dye inside, it was staining all the viscera blue. So it was very difficult for we people to identify the viscera. So at that time, my boss has introduced shot of autoclaved milk. So we were injecting milk and we were seeing the spillage from both the ends of the fallopian tube. That milk is coming and it is white in color. And we remained successful to check the patency of the tube. So after finishing my graduations and when I started my private practice, and when I came across a patient having a tubal block with the HSC. So at that time I was reading Materia Medica and I came across one medicine that is thiocyaninum. Thiocyaninum, that is called the rhodolin, mustard oil, and in the Materia Medica, in symptomatology, it has been solved. It's a resolvent. It dissolves the scar tissue. It removes the adhesions. And this has stuck to my mind. And then I took that thiocyaninum. I told my patient that I will make you a guinea pig and I'm going to try this medicine to open your blocked fallopian tube. Patient has agreed because patient had a full faith on me that whatever you want to do, only just assure me that my wife should not die. Then I said, no, it's nothing going to happen like that. And I took that step to take that thiocyanamide, diluted with the distilled water, and I injected that thiocyanamide into the uterus. And with my surprise, with the guided procedure, with the sonography, I found that some spillage is coming out. Immediately, we took the HSG and I opened that fallopian tube, blocked fallopian tube, with very high success with the help of homeopathy. After that, it has encouraged my confidence. I'll show you the picture of that, my first patient who came to see me after, because I don't have this internet connection, so I can't share my PowerPoint presentation. And I'm sorry to say, but I can share that picture over here. This is my first patient. After 5 years, they came to see me and I took this picture, and patient has given me a sanction that permission that you can share my story with anywhere you want to share. The name of the patient is Sanjay, and the wife to whom I opened the blocked fallopian tube is Babita from Bhavnagar. So after that, again I used the same composition in another patient of my town. I am from Anand, Gujarat, and I was successful to open that blocked fallopian tube. And then again I took the HSG. So within a span of 3 months, that patient got pregnant, but unfortunately, she met with a miscarriage. But one thing I found that with the thiocyanamide, I am able to open that blocked fallopian tube, and I opened that blocked fallopian tube with more than 200 patients. It has also encouraged and increased my confidence to conclude that with the thiocyanamide, it is increasing the tubociliary movement of the fallopian tube. So it helps in the egg transportation. And patient used to get conceived within 3 to 4 months, not longer period. So this homeopathy has saved the money, saved the time, and saved the invasive procedure of the conventional medicine, which is very, very expensive. At that time, if patient has a blocked fallopian tube, the main thing is they visit the gynecologist, and gynecologist to tell that you have to use IVF route only. ICSI was not invented at that time, but IVF is the only route. And with the IVF at that time, it was costing 300,000, means 3 lakhs rupees to 4 lakhs rupees. And once the cycle failed, again, patient has to undergo the same procedure. So it was very, very costly. And with my protocol, with my research, with my treatment, I used to open fallopian tube within no time. It's a bedside procedure. Patient used to go home after a couple of hours after HSG. So it's a non-invasive procedure. So this is the homeopathy has helped the patients. And this is the thing that there was no any side effect. When Dr. Hahnemann has invented homeopathy, Hahnemann having a very great insight about the homeopathy. Hahnemann has put everything in a form of aphorism, just like a Nostradamus. Nostradamus has written everything in a form of aphorism, and now we are giving a sort of a terminology to that aphorism. So same way in homeopathy, Hahnemann has put a lot of things in a form of aphorism, lot of form in a form of observation. A simple example, when patient comes to us in a gynecology that I am having a leukorrhea, which is yellowish in color. Okay. At that time, in Hahnemann's time, no investigations were available to check whether patient having a giardiasis or trichomoniasis. It's only observation of Hahnemann that has made him to put the diagnosis of the giardiasis and moniliasis in a form the color of discharge. The same way, the milky leukorrhea, white discharge, white leukorrhea. Borax is a very good medicine. And with the white leukorrhea, we can give a terminology. We can convert that rubric in a medical language as a moniliasis, candidiasis albicans. So this is the way homeopathy is working, and I always apply my clinical knowledge along with the homeopathic treatment. Recently, I had one presentation on the IFPH platform, and I was talking about the neurology, and one rubric I explained that sensation as if floating in air. We are just repetizing and just we are taking the medicine and we are giving to the patient. No, that's not the way in my practice. What I do, I always consider that from where this rubrics comes or from where this symptoms comes, whether it is related to the hypoglycemia, patient has a low blood sugar level, whether this comes from the vestibular, means ear, whether this comes from the spinal cord, that is causing cerebral ataxia. So when we are combining the medical terminology into a form of rubric, and then if we analyze, then the homeopathy gives a very good results. And then not a single allopathic doctor having any small point to argue with us that your medicine is not working. By the virtue of God, by the grace of God, I am getting so many conventional doctors as my patient over here in UK. I am treating them, one of the ophthalmologists, one of the psychiatrists having a multiple sclerosis, and he's also progressing very well. Many phlebotomists, they are my patients. Physiotherapists are my patient. But thing is that I am giving a scientific explanation to them. In Hahnemann's time, the scientific explanation was not available with the help of documentary proof of investigations, the lab investigations. And here we are giving a documentary proof that here in UK, we have a lot of restrictions about the advertising standard agency. In India, they are putting on their website before treatment and after treatment. Our senior doctor, Dr. Gupta, has just given that example. I can't do this. Otherwise, advertising standard agency will take action against me. So I can't claim that I can do this and I can do that. That's the only drawback over here. Though we can do, but we can't claim. Though we know, we can't put in a form of after treatment and before treatment. But when patient gets better, then it starts as a word of mouth. So in a span of, I migrated in 2004, in a span of about 16, 17 years, I analyzed one thing that majority of the patient has undergone a hysterectomy, and after that they are developing a sort of a incontinence. Why? Because when the abdomen being opened, when the laparotomy has been done at that time, at the time of hysterectomy, we are putting a retractor on a bladder, and that is causing a sort of a bladder neck injury. So bad effect of surgery is leading to the incontinence. And I have treated more than 400 patients with the help of Staphylococcus aureus to get rid of the incontinence. One of the patients from East London, from the platform, she was wearing a nappy all the time. And right now she is completely free from the diaper, only with the help of Staphylococcus aureus. And if we look in the symptomatology of the Staphylococcus aureus, then I must say that it's a bad effect of surgery, injury to the nerves, injury to the bladder neck, and bad effect of humiliation. If we look in the depth of the symptomatology, and if we ask the mental symptom to the patient, then there is always some humiliation, some exploitation, some psychological trauma, which comes from the psychosomatic. That's what Hahnemann has explained, from mind to body. And on top of that, patient is also getting a surgical shock, surgical trauma, which is deranging the nerve innervation. And that's why patient is developing a sort of a leaking. So according to me, it's a leakage of the emotions. Mm-hmm. And this leakage, if we correlate with the homeopathic treatment, patient gets better. Same thing with the eosinophilia. I have done a lot of work on the eosinophilia because Hahnemann has mentioned one very good sentence in an organ of medicine that is called the obstacles to the cure. I always ask patient to bring a blood results. And if I find a higher number of eosinophils than what it is needed, the normal range is 0 to 6. And if patient can get 10, 20, 30, then that is the obstacles to the cure. If we remove that excess of eosinophils from the system, patient respond to the homeopathic treatment very well. It goes without saying. And I have taken that project, that obstacles to the cure. I'm working on that. I'm also collecting all the blood results of the patients. And after checking that eosinophils, and after having a homeopathic treatment, how patient has better. And sometimes this higher number of eosinophils is a predisposing factor for the cancer. In 4 of my cancer patients, I have seen that there is a higher number of eosinophils. Though it has been mentioned in a blood results over here, out of range, but no action. And then after a few years, patient is landing to the this high eosinophil is landing to the predisposing stage of the cancer. So this is all my observation. I won't take your much time because there are so many other eminent speakers are waiting, but I'm highly thankful to Dr. Pawan Kumar Sharma for inviting me and sharing my some experience of my practice to this platform. And really I appreciate Dr. Madan, Dr. Pawan Kumar Sharma, Dr.A.K.Gupta, and all the seniors. Thank you for giving me this opportunity and sharing my thoughts. And if you have any question, you can email me on my email, that is articlinic@yahoo.com. And my website is www.articlinic.com. As I'm very sorry to say, as I don't have power over here, so I can't present my presentation, but hope you have liked my thoughts. Thank you. Jai Hahnemann, Jai Homeopathy. Thanks.
Nikunj, thank you so much for joining us in spite of your difficulties there in Leicester today. I don't know, Nikunj, whether you are able to put your website on the chat box, Thoda sa agar, if you can put Thoda sa, if it is possible, then we will appreciate.
Let me try because
thank you. Your mention of blockage to cure, that is a very, very important point. I hope you will stay with us if you can. There may be some questions.
I will stay.
Hahnemann's thinking about blockage to cure and that whole system approach to understanding health. I think this is very, very important. Even modern medicine can learn so much from this, these small phrases. And the example you gave us is very exciting, very, very important. Thank you, Nikunj, despite the difficulties there with your power connection. Thank you for joining us today. We look forward to just receiving the website. There will be many people here.
Yeah, just I'm typing, sir. I'm typing.
Thank you, thank you, Nikunj. Thank you again. Please stay with us as long as you can. If you come up to the discussion stage, then there'll be many questions for you as you go along. Pawanji, namaskar ji.
Now I would like to request Dr. Premnidhan Pal Chowdhury, sir, Professor and Head of the Department of Physiology, Government Homeopathic Medical College and Hospital, Bhopal from Madhya Pradesh. Welcome, Pal Chowdhury ji, welcome.
Am I visible?
Yes,
you are very visible, very clear, and we can see you very nicely, ji. Thank you for joining us today. Welcome to the platform.
First of all, I would like to give my greetings that Dr. Pawan Sharma searched it out about me and give me a chance to making a connections with all the dignitaries, what I am observing. Previously, I was at once a webinar conducted on the pharmacovigilance, ASU and H drugs. So very, very thanks to all the members of the society. Now, I would like to share that today it is the Dr. Samuel Christian Friedrichs Hahnemann's birth anniversary 267th. Now, on the basis of the paying the homage to the homeopathy in the whole world, we are celebrating the birth anniversary in not in India, but in abroad. And our Ministry of Ayush, National Commission of Homeopathy, Central Council for Research in Homeopathy conjointly organized today's seminar by sharing the thoughts on homeopathy, what homeopathy can do for serving the pupils within objectives that quality of teaching, quality of research, and quality of the practitioners. Nay, what we do, we must think of about first the human being. Whenever the human being is in the earth, we are under the guidance of the nature. If we distract from the nature, we will offering some sort of the elements or the complaints among us. Let us too discuss on the philosophy point. Human body is made up of the anatomy, several structures, and physiology, performing all these structures in coordination. If there is any difficulty or disturbances in coordination of any system, the people beings in disease condition. So how we can find out the patient's complaints in the forms of the symptoms and what we observe on the patient, that is the sign. So why and how the disease had been occurred in the human being, it's a mystery. Why in our daily life, we are in interactions with the food, we are interactions with the several drugs, we are interactions, several interventions, like in laboratory investigation procedures. Now our body is very delicate. How? The question is here, whether all the human beings are reacted to all the elements in particular manner, in a same manner? No, the answer is not, because the individual varies from the individual. This was the first and foremost principle of homeopathy. Hahnemann has got a reason-gifted mind. He had been thought of before 267 years back. And at the time, there was no interventions like investigations, procedure, and all the causative factors to find it out. You see, the history says 170 years back, there is the birth of pharmacovigilance. People are thinking about the cause and effect of the medicines whenever it is applied on the human being. Now, homeopathic principle will never be changed, because these principles are brought up on the basis of the nature's cure. Let us to observe what is in homeopathy. In homeopathy, everybody should have the knowledge, good knowledge on the individualizations, good knowledge on the drugs, pathogenesis, the pure pathogenetic effect of the drugs, and good knowledge about the patient and the health. Hahnemann was the father of all. In my opinion, as my knowledge goes, in my academic year of about 31 years, I am an academician and I am teaching the students in physiology. In physiology and also the clinically to show what is actually homeopathy can do. Let us to talk on the individualization. Why in every year, every person is suffering, but their presentations are not same. Let us to talk about the coronavirus. The coronavirus outbreak teaches us whenever the particular wave comes, the particular symptomatology, that is the sore throat and the fever and the respiratory tract infection was same. But some symptoms have been added. Why some symptoms have been added? Because of the interactions of the virus among the different individuals globally. If we consider the symptomatology of the China or any other country, even in India, it is quite amazing to see the changes in the symptomatology. So individuality of a person's are to be thought of. And here, what homeopathy can do? Homeopathic medicine, particular medicine, is not fixed for all. We treat the patient here. We never treat the disease. If we consider the disease in our aspect, so we will be not in position to cure the person. In my life, in my practice, I have seen so many cases. As the time is very less, so I can share some few cases what have been treated by homeopathically. I have seen the treatment in acute cases and in the chronic cases. In acute cases, patient comes to us with a very severe condition. We have to relieve the person. Suppose a person is suffering from the pain in any part of the body, either in the tooth or in the head or in the abdomen. We have to give the medicine so that we have to relieve it. But here, according to the case taking, homeopathic case taking, if we do not follow, if we just know some group of the medicines and apply one after the another, we are in failure. We are seeing we are in failure. But if we take up the history in very vivid way as directed our master Hahnemann, so we can get a chance, we can get a goal of curing this suffering person in very short time. Next comes to the chronic patients. What we are observing in the chronic patient today, it is the work we are seeing that because of the faulty lifestyle, we are offering so many diseases in our body. A very sad to say, the young people are suffering from the hypertension. We never thought of it. And even the history did not say the people are suffering. The thyroid diseases, hyperthyroidism or hypothyroidism, very common to us, and the diabetic. In the post-COVID complaints, what we are observing, the personal mental disorders and the diabetic conditions are very coming up. Why this type of the diseases are coming up? What is the research behind it? So many research papers are there. People are doing study over the people, over the affected persons. But in my opinion is that if we treat the patient by our homeopathic principles and select the medicines and apply it, we must cure and we have the honor by the people. We never being in the hand, but that people should judge us. Who am I? Whether our medicine is acting on them. So we are taking the consent of the patient. That patient will say, yes, it is for homeopathy. Few days in our digital platform, there was a discussion that India is being popular by treating the people by the homeopathy. It is a fact. But in other countries, there are some laws and that will just like just now the Dr. Dwivedi was telling. Trivedi was telling that he had so many work, he had done so many work. But in nutshell, what we see, what my opinion, I am experiencing and sharing the views on homeopathy that If we understand the homeopathy in its philosophy and the homeopathic medicines and the patient safety we can think of and apply, we can cure the ailing humanity by homeopathy. Jai Hind, Jai Hanuman. Any questions, sir?
Thank you, Ji. Thank you, Professor Chowdhury. Thank you so much for being with us. Number one, sir, thank you very much for being with us today on this special day. And thank you for sharing your kind words. We look forward to having you. Pavanji will organize future events where we look forward to having you with us. Pavanji will also invite you to platforms where we bring together Ayurveda, Unani, Siddha, and other modalities together, sir. And so we look forward to your guidance in shaping future programs, your guidance and strength to enable these discussions between different modalities. And as I said earlier, homeopathy and your understanding of the vital force and your understanding of, as Nikunj mentioned about blockages, these are all real things. And I think we can all learn, not only the practitioners, but also the basic scientists can learn a lot from you people, from how you handle patients. So if you stay with us, sir, we will take questions at the end of the presentations. And Pavanji will...
Only 2 presentations are left, sir.
Okay, 2 more. So maybe we have a little time, sir. Maybe Professor Chowdhury.
I think that
Yes.
if you share the questions at my mail ID, so I can answer.
Thank you, sir.
And
is it possible for you to share your mail ID on the chat
yes,
box? Thank you,
yes,
Ji.
yes. Yes, I can share now.
Thank you, sir. I leave it to Pavanji to take the program forward. But before Pavanji does that, Nikunj, I have put one reference here on study of blockages in homeopathy. Now, I don't know if this is the same thing that Hahnemann blockages to cure. Is that the same thing that Hahnemann presented about blockage to vital force? Is that the same thing, or you had something else in mind? Aapka awaaz nahi aa raha, Nikunj. You have to unmute. Thank you.
Yeah. No, I fully agree with Hahnemann's principle that what he has invented. And really right now, I'm also trying to understand Hahnemann's language. Say, for example, this vital force, a block vital force. Yes, it's a type of vital force as well, because it is preventing the transportation of the egg. And that's why the couple is not able, means the lady is not able to give rise to the another vital force in a form of conception. Yeah, so 100%.
Nikunj,
yes.
what is interesting, a very quick comment, but we will take this point up later into the discussion. The quick comment is that you have vital force, Ayurveda, yoga has prana. They understand it slightly differently. Chinese medicine has qi. So there is some commonality. We would like to hear your thoughts on this, but we will wait till the next presenter. 2 more presenters, sir, and then we open up for discussion. Thank you, Pavanji.
Yeah. Thank you.
Please stay with us. We are delighted to have so many senior practitioners, medical educationists here with us. Dr. Chowdhury, thank you. Pavanji will take us forward to the next speaker.
Thank you.
Thank you.
Now I would like to request Dr. Amita Arora, Dr. Director, ACE Homeopathy Gurgaon, co-founders, Secretary, International Homeopathic Foundation, served as SDHA for 8 years, formerly Senior Homeopathic Consultant, Vaccines Homeopathy, alumni Bharati Vidyapeeth, Homeopathic College and Hospital, and recipient Asia's Greatest Brands and Leaders 2016 at Singapore. Rashtriya Chikitsa Ceremony. I would like to welcome Dr. Amita Arora from Gurgaon. Welcome.
Amita ji, namaskar.
Namaskar.
Welcome to the platform. Very happy to see somebody from Haryana here on the platform.
Same here, sir. Same here.
Bharatiya Vidyapeeth, was this in Pune?
Yes,
BVP?
sir,
Oh,
absolutely.
Pune. Welcome. Namaskar. We have.
Thank you, sir.
Namaskar
First
ji.
of all, thank you, IRES. Thank you, Pavanji. Thank you, Dr.A.K.Gupta, कि जिन्होंने मुझे ये opportunity दी कि मैं आज कुछ present कर पाऊँ यहाँ पे. And Dr. Shashi Mohan Sharma sir, Dr. Jayesh Patel और सबको अपने लोगों को देख के बड़ा अच्छा लग रहा है. We had organized a very good International Homeopathic Congress in Goa in 2014 and at Raj Vivanta Dwarka in 2016 under the banner of International Homeopathic Foundation. So I have been serving homeopathy since almost 20 years now, my clinical practice as well. So ये जो टॉपिक है आज हैनिमैन डे का, होम्योपैथी इन डेली हेल्थ केयर. So I would like to say over here why people do not understand this, that homeopathy has got lot of potential because it is not only now limited to chronic ailments. Daily basis पे अगर मैं बात करूं, morning से हम start करते हैं. If a person wakes up and he has to take a pill daily to control his BP, diabetes, thyroid, एंड उस मेडिसिन को लेने के बाद उनकी बॉडी में साइड इफेक्ट्स ज्यादा होते हैं, तो क्या यूज है उस मेडिसिन का? बिकॉज मेडिसिन टू मी एज अ डॉक्टर, एज अ पर्सन, इज एन अंडरस्टैंडिंग जो हमारी सफरिंग्स को कम करे, हमारी एलिमेंट्स को कम करे, ना कि हमारी एलिमेंट्स को बढ़ाए. I am not against any pathy. I am not against allopathy. I am not against Ayurveda, any other pathy, because I believe every medical science has its own importance. So, but yes, I am a lover of homeopathy and I practice homeopathy. So maybe my love for homeopathy is little more. So what I would like to contribute over here is कि जो लोग इन lifestyle disorders से suffer कर रहे हैं and वो daily basis पे more than 20 years एक ऐसी मेडिसिन ले रहे हैं जो कि आपकी बॉडी पे एक साइड इफेक्ट और प्रोड्यूस करती जा रही है, इससे बेटर ये है कि आप अपनी उस मेडिसिन के साथ साथ होम्योपैथिक मेडिसिन को स्टार्ट करिए एंड धीरे धीरे आपकी वो जो मेडिसिन है आपके होम्योपैथिक डॉक्टर जो हैं वो बंद करा सकते हैं. आई वुड नॉट से कि इमीडिएटली स्टॉप दिस मेडिसिन बिकॉज इट इज नॉट राइट. आप अपने मेडिकल डॉक्टर की एडवाइस पे चलें एंड विथ होम्योपैथी धीरे धीरे उसकी डोजेज या फिर उसको कम किया जा सकता है. पॉइंट नंबर 2 इज कि जो ये मेडिसिन साइड इफेक्ट्स प्रोड्यूस करती हैं उसके लिए एक एडिशनल एक और मेडिसिन कई बार इंट्रोड्यूस करनी पड़ती है. सो होल डे अ पर्सन इज टेकिंग मेडिसिन एंड मेडिसिन व्हिच इज आल्सो नॉट राइट, क्योंकि एक ऐसी मेडिसिन होनी चाहिए जो होलिस्टिकली आपको कवर करे, आपकी कंप्लेंट्स को एड्रेस करे एंड आपके जो भी डॉक्टर हैं, आपके जो होम्योपैथिक डॉक्टर हैं, वो आपके सब चीजों को लेके एक ऐसी मेडिसिन निकालें जो कि आपकी इन सब प्रॉब्लम्स को कवर अप कर सके एंड आपकी बॉडी पे उसका कोई साइड इफेक्ट भी प्रोड्यूस ना हो. अब आ जाते हैं हम लोग चिल्ड्रन एलिमेंट्स पे, बिकॉज मैं थोड़ा पॉइंट वाइज ले रही हूँ हर एक चीज को. बच्चों में आजकल पेरेंट्स देखते हैं कि बहुत ही कॉमन हो गया है कफ कोल्ड होना, बिकॉज बच्चे जब स्कूल में जाते हैं पॉल्यूशन से, पोलन से, बहुत सारे ऐसे ट्रिगर्स होते हैं उनके लिए जिससे कि उनको इन्फेक्शन होने के चांसेस बहुत ज्यादा हो जाते हैं. मैं यहाँ पे बोलना चाहूंगी कि कोई भी ऐसी मेडिसिन, एंटीबायोटिक्स, स्टेरॉइड्स या कोई भी मेडिसिन ऐसी होनी चाहिए जो कि आपके बच्चे के लिए हार्मफुल ना हो, जिसके कोई बच्चे के ऊपर साइड इफेक्ट्स ऑन अ लॉन्गर टर्म ना हो. इस कोविड टाइम में भी मैंने देखा है कि जितने भी पेशेंट सफर किए हैं उनकी बहुत लॉन्ग टर्म तक मेडिसिन चली हैं. कोविड एक ऐसी चीज थी जो कि हम डॉक्टर्स के लिए भी नहीं थी, रिसर्चर्स, साइंटिस्ट, सबके लिए, पूरे वर्ल्ड के लिए नहीं थी. एक कॉमन कफ कोल्ड जैसी चीज जो कि जिसमें अगर एंटीबायोटिक्स की जरूरत पड़ती है या स्टेरॉइड इनहेलर्स की जरूरत पड़ती है, तो आई डोंट थिंक दैट इज अ राइट थिंग, बिकॉज आपको स्टेरॉइड्स, इनहेलर्स या एंटीबायोटिक्स की जरूरत इन्फेक्शन के केसेस में पड़नी चाहिए. यस, अगर आपके लंग्स में ऐसा इन्फेक्शन है जो कि एंटीबायोटिक्स कवर करती है या स्टेरॉइड्स कवर करते हैं, ब्रेथलेसनेस इतनी ज्यादा है कि आपको होम्योपैथिक मेडिसिन थोड़ा टाइम ले सकती है रिकवरी देने में, तो आप जरूर एंटीबायोटिक्स, इनहेलर्स या स्टेरॉइड्स की हेल्प ले सकते हैं, बट फॉर अ लिमिटेड ड्यूरेशन अंडर द गाइडेंस ऑफ योर मेडिकल डॉक्टर. क्योंकि कई पेशेंट्स के साथ मैंने देखा है कि जब प्रिस्क्रिप्शन उनको मिलती हैं वो अपने डॉक्टर से कंसल्ट नहीं करते एंड उनको बहुत प्रोलॉन्ग टाइम तक वो जो है यूज करते रहते हैं. मे बी योर डॉक्टर नोज कि आपको 5 डेज से ज्यादा उस मेडिसिन की जरूरत नहीं है, मे बी कि आप एक गलत मेडिसिन जो है बहुत लंबे टाइम तक ले रहे हैं, तो आपको अपने मेडिकल डॉक्टर के अंडर ही गाइडेंस में ही चलना चाहिए। बच्चों के लिए कॉमन कफ कोल्ड के अलावा होम्योपैथी में बहुत अच्छी मेडिसिन हैं जो कि एड्रेस करती हैं टीथिंग प्रॉब्लम्स को। छोटे बच्चे हैं, इन्फेंट्स हैं, जिनको टीथिंग इश्यूज होते हैं, उनके लिए होम्योपैथी बहुत अच्छा काम करती है। ऐसे ही जो मिल्क इंटॉलरेंस के केसेस आते हैं, बच्चा दूध पीता है और एकदम से वॉमिट कर देता है, या मिल्क जो है वो पूरा कर्डल्ड होके निकलता है, डाइजेस्टिव सिस्टम बच्चे का ठीक नहीं रहता, उसके लिए होम्योपैथी बहुत ब्यूटीफुली वर्क करती है। मैंने बहुत अच्छे रिजल्ट्स देखे हैं। रिटार्डेड ग्रोथ जो हो जाती है, बच्चों की एपेटाइट अच्छी नहीं है, पेरेंट्स को आजकल ये बहुत ही मेजर प्रॉब्लम आती है कि बच्चा खाना नहीं खाता। इट इज नॉट द प्रॉब्लम कि बच्चा खाना नहीं खाता, बट पेरेंट्स जो हैं वो ना तो अपने बच्चों की एपेटाइट मॉनिटर कर रहे हैं, बिकॉज उनके इतने बिजी शेड्यूल्स रहते हैं कि बच्चे को जो चाहिए या जैसे चाहिए वो वैसे ही फीड कर देते हैं। टीवी चल रहा है, मोबाइल ऑन है, बच्चा कार्टून देख रहा है और आप उसको फीड कर रहे हो, लेकिन आपको नहीं पता कि आपके बच्चे की एपेटाइट क्या है। उसकी एक नेचुरल एपेटाइट बढ़ना बहुत जरूरी है। हर एक चीज के लिए मेडिसिन ऑप्शन नहीं होना चाहिए, लेकिन अगर आपके बच्चे को जेन्युइनली एपेटाइट की प्रॉब्लम है तो होम्योपैथी इसमें बहुत अच्छा वर्क करती है, बिकॉज होम्योपैथी आपका पूरा का पूरी डिटेल हिस्ट्री लेती है, इंक्लूडिंग द मदर्स जेस्टेशनल पीरियड एज वेल। सो मदर का जो जेस्टेशनल पीरियड की हिस्ट्री है वो एक बच्चे की ग्रोथ के लिए और बच्चे की कंप्लेंट्स के लिए बहुत इंपॉर्टेंट होती है। फादर की तरफ की फैमिली हिस्ट्री और फादर की डिजीज हिस्ट्री भी बहुत इंपॉर्टेंट होती है बच्चों की एलिमेंट्स में। एंड आई बिलीव होम्योपैथी इज सच अ मेडिकल साइंस, इट इज सच अ ब्यूटीफुल मेडिकल साइंस जो जीन्स पे या फिर हेरिडिटरी जो प्रॉब्लम्स आती हैं उस पे वर्क करती है। नेक्स्ट आ जाता है बच्चों को बेड वेटिंग, लूज टूल्स की प्रॉब्लम बहुत कॉमनली होती है, गैस्ट्रोइंटेस्टाइनल ट्रैक्ट के इन्फेक्शन बहुत हो जाते हैं, एंड शायद लोगों को ये बिलीव होता है कि होम्योपैथी टाइम लेती है मेडिसिन जो है वो रिजल्ट्स दिखाने में, लेकिन ये एक गलत बिलीफ है। जब आप होम्योपैथिक मेडिसिन लेना स्टार्ट करेंगे, हो सकता है आपके होम्योपैथिक डॉक्टर आपको एक ऐसी मेडिसिन दें या राइट डोजेज दें कि उसको कितने कितने आवर्स में आपने रिपीट करना है, वाटर में मिक्स करना है, नहीं करना है। उस तरीके से जब आप एक अपने होम्योपैथिक डॉक्टर से बात करके गाइडेंस में चलेंगे, आई एम श्योर कि रिलीफ बच्चों को बहुत अच्छा आता है। नेक्स्ट आई कम टू एब्डोमिनल कॉलिक प्रॉब्लम। बच्चों को बहुत प्रॉब्लम होती है स्टमक केक की, डेली जो है उनको स्कूल में या कहीं से भी प्रॉब्लम्स आ जाती हैं और पेट में काफी तकलीफ होने लगती है। तो यस, होम्योपैथी वर्क्स वेरी वेल इन एब्डोमिनल कॉलिक्स। स्कूल गोइंग चिल्ड्रन में वॉमिटिंग, फीवर की यहाँ मैं अगर बात करूं सॉरी फीवर की अगर मैं बात करूं तो लोग बाग एकदम स्विच करना चाहते हैं ऐसी मेडिसिन पे जो कि बिल्कुल ड्रॉप कर दे इमीडिएटली फीवर को, बट होम्योपैथिक अगर कोई लेता है मेडिसिन एंड इन राइट डोजेज, राइट पोटेंसी, तो होम्योपैथिक मेडिसिन से बहुत जल्दी फीवर जो है वो नीचे आ सकता है। मेरे पास बहुत पेशेंट्स ऐसे आते हैं, बहुत बच्चे ऐसे आते हैं जिनको हाई फीवर होता है एंड कई बार मुझे रिपीटेटिवली थोड़ी डोजेज देनी पड़ती है अकॉर्डिंग टू सिम्टम्स। I will not name the medicines over here because it depends from patient to patient. तो मुझे वो एनालाइज करके ही मेडिसिन देनी पड़ती है कि कब मुझे कौन सी मेडिसिन कितने आवर्स में देनी है, कब किस तरीके से रिपीटेशन होगा उसका। नेक्स्ट आई कम टू इम्यूनिटी। क्योंकि बच्चों में खासकर एक्सपोजर बहुत ज्यादा रहता है इन्फेक्शंस का, बच्चों की इम्यूनिटी बहुत डाउन हो रही है एंड बच्चों की इम्यूनिटी स्लीप की वजह से भी बहुत डाउन हो रही है। मोबाइल फोन्स, टीवी, लैपटॉप्स और कोविड के टाइम पे तो ये 2 साल जो बच्चों के निकले हैं बहुत ही लो इम्यूनिटी लेवल्स हो गए हैं, बिकॉज कोई फिजिकल एक्टिविटी नहीं है, कुछ नहीं है, सोशलाइजेशन नहीं है। तो जो ये लो इम्यूनिटी लेवल्स हैं उसको स्ट्रॉन्ग कैसे किया जा सकता है? आपको बच्चे को गाइडेंस, ट्रेनिंग, फूड, मेडिसिन, सब चीजों का सपोर्ट जो है वो बहुत जरूरी है, तभी जाके आपके बच्चे की इम्यूनिटी जो है वो डेवलप हो पाएगी, अदरवाइज उसकी इम्यूनिटी लो रह जाएगी। सो लो इम्यूनिटी जब होगी तो बच्चे को इन्फेक्शन कैच करने की टेंडेंसी बहुत ज्यादा और बन जाती है। मोशन सिकनेस, मेरे पास कितने ही केसेस होते हैं कि जिसमें मोशन सिकनेस की प्रॉब्लम्स आती हैं, क्लॉस्ट्रोफोबियास की प्रॉब्लम आती है कि जब वो ट्रैवल करते हैं तो बच्चा पूरे टाइम वॉमिटिंग करता रहता है। एंड बिलीव मी, मैंने कई अपने पेशेंट्स की मेडिसिन जो है ट्रैवलिंग से 2-3 घंटे पहले स्टार्ट करी है एंड दे हैव गॉट वेरी गुड रिजल्ट्स कि बच्चे को मोशन सिकनेस नहीं हुई। ऐसे ही जब वो वापस आते हैं और उनको ट्रैवल करना होता है, देन आई अगेन टेल देम कि ये मेडिसिन तब स्टार्ट करनी है। पूरा टाइम जब तक वो ट्रैवल में रहते हैं, आई डोंट टेल देम टू स्टार्ट द मेडिसिन एट दैट टाइम, बट फॉर 4-5 hours if they are traveling continuously, they will have to switch to those dosage. So yes, होम्योपैथी बहुत अच्छी तरीके से वर्क करती है इन सब चीजों में। नाउ कमिंग टू फीमेल कंप्लेंट्स, फीमेल कंप्लेंट्स के लिए अगर मैं बोलूं तो मैंने बीइंग अ फीमेल, मेरे पास बहुत केसेस आते हैं फीमेल पेशेंट्स के, वाइट डिस्चार्ज, इनफर्टिलिटी, फाइब्रॉइड्स, ओवेरियन सिस्ट, यंग फीमेल्स में एमेनोरिया की प्रॉब्लम, एनीमिया की प्रॉब्लम, इतनी मेजर प्रॉब्लम्स होती हैं। और कई कई प्रॉब्लम्स तो ऐसी होती हैं कि जो वो अपने दूसरे मेडिकल डॉक्टर्स से कई बार डिस्कस भी नहीं कर पाई एंड वो अनडायग्नोस्ड रह गई प्रॉब्लम। तो जब हम होम्योपैथिक केस टेकिंग करते हैं और हम पूरी हिस्ट्री लेते हैं पेशेंट्स की, एंड बीइंग अ लेडी डॉक्टर, लेडीज बहुत कंफर्टेबल फील करती हैं मुझसे शेयर करने में, तो मैंने देखा है कि इतना अच्छे रिजल्ट्स आए हैं होम्योपैथिक मेडिसिन के। आई एम नॉट सेइंग कि यूट्राइन फाइब्रॉइड्स खत्म हो गए, आई एम नॉट सेइंग ओवेरियन सिस्ट खत्म हो गई, बट उन प्रॉब्लम्स की वजह से जो कि सर्जिकल केसेस बन जाते हैं और पेशेंट सर्जरी कराना नहीं चाहता, तो उन केसेस में मैंने सिम्टम्स को डेफिनेटली उनके कम किया है, उनकी सफरिंग्स को रिड्यूस किया है। मेनोरेजिया, मेट्रोरेजिया, इतनी कंप्लेंट्स आती हैं ब्लीडिंग डिसऑर्डर्स की कि उसमें अगर हमने राइट होम्योपैथिक मेडिसिन दे दी, कॉन्स्टिट्यूशनल मेडिसिन एज वेल एज वो एक्यूट केस जिसमें कि उसको ट्रबल हो रही है फीमेल को, उस केस में होम्योपैथिक मेडिसिन बहुत अच्छा वर्क करती है। सो मैंने ऐसे सर्जिकल केसेस भी देखे हैं जिनको सर्जरी पे नहीं जाना पड़ा। अभी रिसेंटली मेरे पास एक फीमेल आई थी, उनके फाइब्रॉइड्स बहुत बड़े हुए हैं, एंड लेट मी एडमिट दैट आई टोल्ड हर कि yours is a surgical case, if you want you can go for surgery, if you are opting for homeopathy you will have to wait long, because देखिए फाइब्रॉइड्स इतनी इजीली होम्योपैथी से नहीं जाते। हम लोगों को ये एडमिट करने में भी कोई चीज जो है पेशेंट से ना तो हाइड करनी चाहिए ना शर्म आनी चाहिए। हर एक ही मेडिसिन की, हर एक साइंस की एक लिमिटेशन जरूर होती है। एंड knowing the fact, because she was my very old patient, she has given me full liberty कि ma'am I trust you, I trust homeopathy, so please go ahead with my treatment, I don't want to go for surgery, I don't want to get my uterus removed। जब ये फेथ कोई देता है ना होम्योपैथी को लेके, and if somebody tells you that yes I'm giving you that faith, please go ahead, like we ask our God that God I have faith in you, please answer my prayers, I'm praying you। So हम लोग भी एक फेथ के साथ प्रे करते हैं। सेम गोज फॉर डॉक्टर एंड पेशेंट रिलेशनशिप। When your patient shows that trust on you, when your patient shows that trust on homeopathy, we should definitely give our sincere efforts। पहले से ही कोई एक जजमेंट हमें नहीं दे देनी चाहिए कि नहीं ये ट्रीट नहीं होगा, वो नहीं होगा, and we should not experiment as well। We should be very clear with the patient that this is your stage, this is the thing, and these are the results we can expect in certain period of time। I'm sorry. Thank you। So in certain period of time, regular monitoring करना भी बहुत जरूरी है। अल्ट्रासाउंड करना या कोई चेस्ट एक्सरेज हैं या ब्लड टेस्ट हैं कि हम लोग किस स्टेज पे हैं। जब हम डायबिटीज पेशेंट्स को मेडिसिन देते हैं तो हम लोग हर 3 months में उनका HbA1c, ब्लड शुगर, फास्टिंग, पीपी, ये सब मॉनिटर कराते हैं, क्योंकि जो चीज सामने दिखेगी पेशेंट को उसका ट्रस्ट लेवल जो है और ऊपर जाएगा कि यस आई एम गेटिंग द रिजल्ट। मैंने अपनी धीरे धीरे बाकी मेडिसिन रिड्यूस कर दी हैं और अब मुझे इसी मेडिसिन पे रहना है, एंड एक मेंटेनेंस डोज जो है वो डेफिनेटली लेते रहनी है। So आज इस हैनीमैन डे पे बिकॉज ऑफ लिमिटेशन ऑफ टाइम मैंने कुछ ये छोटे छोटे जो हैं सबमिशंस थे on infants, on children ailments, female disorders, on lifestyle disorders. So I could justify these points on in this particular time frame given to me. But I definitely look forward that if required, we will definitely hold something where we can talk more about it. We can spread awareness to common people because देखिए आप हम सब मिलके जो ये सब कर रहे हैं, we are doctors, we can talk, we are medical people, we can share everything freely, but this has to go beyond that. This has to go to normal people, local people, masses, and we should utilize the medias as well, social media, and we should involve print media wherever we can definitely put this awareness about homeopathy. So thank you so much everyone for your time, and thank you for giving me this opportunity that I could submit my few points on this World Homeopathic Day.
Thank you, madam.
Thank you.
Thank you very much. Sir, now I have a video of next speaker, but before that, I welcome Dr. Vincenzo Valengi and Madan sir. Please, we can invite him before that video, of Dr. Sukul from Calcutta. He is in Guwahati at present. Welcome.
First, Amita ji, thank you so much for sharing. Aapne jo the few points you have shared about children and aspects about female health. These are very important things. We have also had excellent interventions by Nikunj from here in the UK for difficult cases, fallopian tube, blocked fallopian tube, etc. So there are many areas where much more can be done. I want to invite Professor Vincenzo Valenzi, who is joining us from Florence in Italy. Vincenzo? Vincenzo? Hello? No, Vincenzo is busy with something. I think he's busy on a call. Pavanjit, if you are ready, Vincenzo will join us when you are. Thank you.
Sorry to interrupt, sir. Can I take a leave? I have some personal
Please,
work.
Amita ji, thank you so much for being with us. Thank you, Namaskar ji. If you put your contact details on the chat box, then some people will be able. Thank you. Thank you for being with us.
Giving me the opportunity to speak over here. Let me introduce, and I share my screen. So I'm the director of Sukul Institute of Homeopathic Research in Kolkata. I'm the member in the research committee in the LMHI. We have collaborations in Thailand, we have collaborations in Philippines. I am the editor of Clinical and Experimental Homeopathy. It has been published by Sukul Institute of Homeopathic Research, an online journal. I'm also in the editorial board in several journals being published from United States, London, UK. And you can see that those journals are nowhere related with homeopathy. So homeopathy being nowadays, it's being so popular in the modern science that they need to hire people, an expert like me, to judge the manuscripts that is being submitted into their journals, which are, of course, on the alternative medicine aspects. So that's the reason that I am in the editorial board of several journals which are nowhere related with homeopathy. And you can see these are all the mainstream journals. I'll briefly point you out that a couple of cases, because I am also attached with the Ministry of Public Health in the Thailand. So I used to go there. I have one patient, I remember, you can see. This is a discharge summary of a Thai patient that has been, at the CT report, you can see left-sided hemiparesis. And here is the condition of the patient. You can see left-sided, left side, left hand. It's not being equally raised. So the day the patient came into the attack, cerebral attack, and I think within a couple of days, they contacted me. So and I given her the medicine over phone and into my regular schedule to visit Bangkok. I went to see her and admitted into the hospital. So there are a few medicines, of course, that is really remarkable while working with the stroke patients. And I have given her Arnica 1M and also a few medicines, of course, with the series and within a month of span, I think she could able to walk. And really, this much of achievement can be achieved with the homeopathic medicines, where this infrastructure of a hospital is not giving that kind of support or that kind of help where the person could able to walk again. Of course, there are physiotherapists which are not with the medicines, but with the physiotherapy and with the help of the homeopathic medicines. So this was a remarkable result. I'm also now talking about deadly disease, you can say this dengue. And this is remarkable when the patient came to me, when the platelet of the patient came down to only 11,000. You see the 11,000 in the platelet here. And I given him bryonia with the symptoms, but with the bryonia it did fail. So it came down to even 5,000, and quickly I changed the medicine. And you remember this patient is in a hospital system. So they are being transfusion of the platelets have been given, but within half an hour it came down. And again, it rises for a few minutes with the platelet infusion, and again it came down, so it didn't settle. And their patient family members, they are all crying, and they are just waiting for the death of their family member. So you can see the dengue platelet of this dengue patient is 5,000, even low in 4,000. So just almost going to die. The other parameters of the blood. And now you can see this has been gone up. And now it is 31,000 with the medicines only. And then going up, up and up, 73,000, 85,000. So all this has been happened within, I think, within 48 hours or so, because you do not have that much of time to correct yourself if it is wrong. So you have to be very correct with the selection of the medicines, because you do not have the time and you are playing between the life and death. So this is something more important, because it is so acute in the sense that it is totally life-threatening. And in fact, the situation, it came up in the course of a few days with this patient that he is just waiting to die. Of course, this is a COVID period and pandemic period we have passed over. And we, the Sukul Institute, the president is Professor N.C. Sukul, my father, who have developed a COVID nosode for COVID-19. And with the nosode, we have tried, and it is quite remarkable that this nosode is not only working with the treatment of COVID patients, but also it works with the preventive as for COVID-19. And moreover, there are so many cases that are being not so violent during that stage of COVID when the patient is suffering. But once the COVID period is over, this post-COVID is something sometimes is more dangerous than the COVID period. So we have seen this COVID nosode has been more active in all the 3 states, preventive as a preventive, during the treatment, and of course the post-COVID. Generally, in other nosodes like tuberculinum, if you say, is not meant to cure in case of tuberculosis, but in cases somehow it is COVID-19 nosode, and it is being meant to cure the COVID-19 patients. So there are so many reports I have, because I personally treated so many COVID-19 positive cases successfully, and you see, there are all the RT-PCR reports positive. And here I can see that there are all the age group. You see, here the age is 83 years old. And he has been survived. You can see this 83-year-old COPD patient, and he has been survived with this COVID nosode and other, of course, homeopathic medicines as far as the symptoms goes. He's my father in this. This is the laboratory of our Sukul Institute of Homeopathic Research in Shantiniketan. And I just take you to the Western countries where you can see, you can have a flavor that how homeopathy or the alternative medicines is out there in the Western countries. This is the Germany Field Clinic Hospital in Germany. You can see this is the inside of the field clinic, and you see the trees, plants are in there. And there are the see-through, the roof, so that the light can come inside. And it is always being on the top of the hill. And this is the infrastructure of inside the Field Clinic Hospital in Germany. He is the director, Dr. Stephen Hiller. And again, the Paracelsus Hospital, you must know this Paracelsus Hospital, quite an old hospital in Germany on alternative medicines. So you can see this, all the common thing is that, you see the windows, this part of the wall is see-through, so that the patients have always the access, so that they can feel the changes of environment, because in Europe the environment changes quite in every couple of hours, so they can feel the changes. So that's the reason this is not being confined with the walls, but it can see through. You see the quite modern instruments are there out there. This is the Glasgow Homeopathic Hospital, again in the top of the roof, top of the hill, inside of the hospital. See, this is quite a big structure, and of course this is a good infrastructure with, and again, the see-through wall, so that they can feel the changes of the weather every time. This is Robert Bosch Hospital in Stuttgart in Germany. Of course, this is not the hospital meant only for the alternative medicines, but of course there is a department in the Robert Bosch Hospital in Germany. You see, this is the natural Heilkunde in German. I'm sorry, I can read it out, and integrated medicine. And this is the thermal pad that is being used for the cancer patients. And this is the smaller thermal pad that is being used. You can see that the lying on the stretcher of cancer patient. And this is the Poirot laboratory that I visited in France, in Messimy. Inside their laboratory, they have allowed me to see how the homeopathy medicines, the Poirot medicines are being prepared and manufactured. And the globules out there in the bag, the officials of the Poirot, Royal London Hospital for Integrative Medicines. I had the opportunity to check a patient out there with Dr. Brian Kaplan, and the patient was somewhere around, I think, 78 years old, and we could see him nearly 2 hours. So after 2 hours, we could able to select the remedies. We had 6 doctors in the board, and I was one of them. This is the book, High Dilution Pharmacology and Homeopathy, written by my father, Professor N.C. Sukul. This is another book, High Dilution Affects Physical and Biochemical Basis co-authored by myself as well with my father name also Sukul. And this book was so popular that it has been translated into Italian person. And also this has been very much popular in Italy. Another book that is transdisciplinarity and translationality in high dilution research, Cambridge Scholars Publishing from United States, from UK. This is a course that we offer with various collaborations. This is the online journal, Clinical and Experimental Homeopathy. I invite you all to send the manuscripts to publish. This is the indexed, the journal, and this is the Congress, Second World Congress, held in Bangkok in November 2019. And there were 26 countries, more than 220 participants. The next Congress, Fourth World Congress, will be in 2021 April, after a few days, this year. So I invite you all to join. This will be, of course, a webinar. I'll send you the link in due course. And this is the, the birthday of today. That is this great man, this Samuel Hahnemann. And this is the cemetery in Paris. And I was standing and lucky enough to pay homage at his cemetery. And also this day, the birthday of Dr. Samuel Hahnemann has been the World Homeopathy Day. So thank you all. Thank you very much for your patient hearing. Thank you.
Thank you.
Excellent presentation by Dr. Sukul. So I now stage is handed over permanently to Sri Madan sir. Welcome sir, welcome sir. I would like to hand over your moderation. You are my guide, mentor. Vincenzo is here.
Vincenzo is here, but he might be busy, but he will join us.
Stage is yours, sir. I am taking your permission for 15 minutes, sir.
Thank you, Pavanji. We will keep the floor alive. Many people, we don't have too many people left with us here, but there are enough people here to keep a discussion going. We see some new faces here. Vincenzo, thank you for being with us today. And Hema, thank you. Bharti Sehgal, thank you, Ji, for being with us. Sanjay Kumar, Ram Pravesh Shah Ji, and Dinesh Kumar Das, thank you for being with us. The floor is open for any questions, comments. I think what has come out of today's discussion is more convincing evidence and confidence that is being given to us by practitioners from India. India is very fortunate that unlike many parts of the world where homeopathy has bad press, homeopathy is not encouraged. In India, we have an entire ministry, the Ministry of Ayush, with a cabinet level minister and also a minister of state, looking after the interests of homeopathy. And it is based on the kind of expertise that we have and the kind of results we are obtaining. And there is no reason why other nations of the world cannot have this. And it seems unfortunate that the benefits of homeopathy is not open to other people of the world. Clearly, like any medical education system and practice, it requires a deep study, as seen from our presenters early on. It sometimes requires many, many years of study and many, many years of practice before you can get the kind of successes that they talk about. So that is one important point, that it requires a lot of expertise. And it also requires skills in areas that are sometimes difficult to teach, I suppose, and areas where we might not have the technology to measure things. Now, a lot of people will not like that situation, but that is where we are. The floor is open now for questions, comments, discussions. And so, Vincenzo, thank you so much for joining us today from Italy, from Prato, Florence in Italy.
Chinatown.
Chinatown. Thank you for joining us today, Vincenzo. You have heard today, unfortunately, there were some of the presentations were in Hindi, some were in English, some were in a mix of
problem. I am usual to Russian, Cyrillic, Ukrainian, so I don't understand too much. Today I understand a lot.
So your question, you had asked a question about the subtle aspects, and the entire principle of homeopathy works largely on that area of the vital force. And I don't know if there is somebody in the floor who would like to add something about the vital force, and whether they want to say something about the subtle force that is operating there. A lot of people have left us today because today is a special day and there are many webinars going on in other locations also. There's the International Federation for Homeopathy Practitioners, where similar event is happening today. It started at 8 o'clock India time. Vincenzo, would you like to add something or some questions?
Yeah, just I want to share an experience just now during the seminar. I am working today in emergency medicine, and arrived in my office a woman with nausea and vomit, strong from some day after surgery of appendicitis. 20 years ago, 20 days ago. And after I visit Madame, epigastric and great disorder in intestine, in bowel, and after I look to her subtle body, I take care of subtle body and fire in particular, and she come well because he was quite quite nervous, quite anxious, and after my treatment, she come back well, and she asked me, my problem is mind, in the brain, and indeed the answer was yes, for psychosomatic danger, and that involved the subtle body and chakra. That connect mind, brain, body interaction and disorder. So many disorders you can treat as a panic attack. You can treat with the work on subtle body, on astral body in particular, and on dot and fire, apart the other 5 elements and 7 chakras, the mind that you have. It is quite interesting and enigmatic, of course, because it seems something of shamanic, esoteric, but it is indeed the real activity that we can develop with immediately change in the neurophysiological state of mind, body, function, and improving of quality of life, performance and wellness, and the efficiency of body. So this is line for research that we must develop, and also for homeopathy. You can have by boron cocculine that colleagues know very well. I make some tests in Cape Canaveral 15 years ago in a parabolic flight in NASA Space Center, and it worked quite well. Cocculine has so many problems could be managed with cocculine and many other drugs. The main problem of high dilution is that you go to change the paradigm of concentration. because in the main school of medicine is the concentration that make drug. Here we see nonlinear interaction that are not connected with the concentration of drug, no? A minimum efficacious concentration of drug that we got to measure in pharmacokinetics, as example. And we have indeed that a very high dilution with the absence of molecules, sometimes only the memory of molecules of the drug can be effective as in high potence power homeopathic dilution. It is a great enigma connected to molecular signaling of homeopathic drug, but it is the same for allopathic drug that can have some show some molecular signaling activity without intake, as in the skin application of diclofenac, clonidine, hormones, and many other drugs that you can use for transdermal application. In this case, you never have a pharmacokinetics CEM, concentrazione minima efficacia. You have some other mechanism. You must think to physical mechanism that is connected, maybe as we discussed in coherence in our webinar in the last years, to vector potential that in the Maxwell equation play some role very important in vital force, maybe, because I hear that we discuss also vital force, and play some role in the coherent effect of some molecular signaling. The main problem is that in Europe, apart the very wonderful, fine structure, hospital, center, homeopathic, integrative medicine in London, in Great Britain and Germany, main part of scientific community don't pay attention to nonlinear, very high dilution interaction in chemistry and physics, because they don't pay attention to nadir or meridian system. Apart, absolutely, they pay no one attention to chakras, body, vital force. This is a great problem that we must look for it to find some strong scientific development. So I think that in this day we must launch international program of research with the best university connected under direction of India, maybe, I think, where you have, as you remember, to us, a Ministère Voyage. So India could lead. India is a great country with the new economy, a very high level of science that must be applied to this area of life and the nation, and the technology of drug too. So maybe it is a great opportunity to do something.
Thank you.
In this area, and only science can give us the answer. Otherwise, we stay on the esoteric and non-conventional complementary alternative area that is not correct, because we work in the area of life, natural science, and physics, biophysics, quantum chemistry, anatomophysiology, etc. In this area, we must clear some key points to understand better what happens in life and nature, and in therapy with homeopathic IRES system, to body soul.
Thank you.
Thanks very much for your attention.
Vincenzo, thank you so much for pointing out importance of non-linear effects in biological systems. That's very, very important. And second one point I have put in the chat box is that India, because it has official recognition of these systems and also the ancient knowledge about aspects like nadis and chakra and all these things that are part of our Ayush ancient texts, it will be easier for India to take forward this research. So thank you so much for sharing this. There is one person here with us, Hema Malini. Hema is joining from Chennai. She has a very special interest in nadis and chakras. Hema, namaskar. So if Hema is available, then she can talk to us a little bit. If Hema is unable to connect, then I want to invite Bharti Saigal. Bharti ji, namaskar. Bharti ji, namaskar. Sanjay Kumar ji, Sanjay ji, namaskar. Sanjay ji, namaskar. Sanjay ji, can you hear me?
They go out maybe.
Oh, no, they are here. Let me see how to. Sanjay ji, if you can hear me. Bharti ji, can you hear me? No, maybe they have gone out. I want. Domaji is here. Domaji, namaskar.
मदन जी नमस्कार।
Domaji, thank
सभी
you
को
for
मेरा
joining.
विनम्र प्रणाम।
Thank you for being with us today. Today is a very special day. We are celebrating Hanuman's birthday, and we are happy that you could join us briefly. You have heard today from Dr. Vincenzo Valenci joining us from Prato, Florence, near Florence in Italy, and his call that there needs to be a lot of active effort from India to look at some of these areas of research that is related to the effect of the effects that we see with homeopathic dilutions and other areas in the Ayush modalities as a way to open up new avenues in future health and research, health and care and research in that domain. Domaji is a very senior, Vincenzo Domaji is a very senior Ayurveda doctor. He's based in the state of Telangana in southern part of India, and treats a lot of people with his knowledge and wisdom. Domaji, namaskar. Thank you for being with us. If you wanted to share some thoughts, then we are welcome you. Vincenzo, would you like to add anything more?
No, I just after I must I have a visit. So I think that the great potential of Oriental Hindu tradition must be developed. Must be developed in modern science. I think this is the game that we must play.
Thank
in
you.
the future months and years. And we must put the power of your country to any level for this mission. Of course, we need also that community Ayush will be in the game, because the experience, the expertise is essential to develop a deep science in the area. It's not too easy. Now I must go. I come back.
Thank you, Vincenzo. Thank you for joining us today. We are almost to the end of the program, and
okay. See you later.
Thank you.
Ciao.
Namaste.
Bye.
Namaste. Ciao. 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 If there are no more questions and comments from the floor, I take this opportunity to thank all the participants today for their wonderful contributions on this very special day related to homeopathy is an area that is benefiting a lot of people. The science behind this is still not completely understood. And there is so much more to learn from doing a very systematic study on many, many aspects of what governs homeopathy. I take this opportunity to thank everybody here with us and those who are joining us on YouTube or the live stream. We welcome any comments. You can reach us on the Independent Research Ethics Society website. The details are easy to access on the internet. Just a Google search will reveal the Independent Research Ethics Society, and you can see all the programs that we've held till now. They're all archived, the recordings there. So do visit, do view, do share your thoughts and comments. Take this opportunity to thank all of you who have joined us today and continue to join us in future programs. Thank you. Thank you and good night.